Good morning. I would like to welcome you all to our special June 26th BOCC meeting. We are going to begin with a moment of silence and the Pledge of Allegiance, so please stand. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, this morning I will be sitting in for Commissioner Jenkins, who is absent due to a prior medical commitment. And may I have a motion for approval of the agenda?
So moved.
Second.
Okay, all those in favor say
Aye.
Aye.
Opposed? Motion carries unanimously. And I want to just remind everyone that we will be accepting public comment online through the email system. And now, once the agenda is approved, we're cutting that off. Is that correct? Okay. Okay, we're going to start with our presenters this morning. And our first presenter is Carol Ann Vitani from the Department of Health.
Good morning, Commissioners, and thank you once again for allowing me to give you an update on our COVID-19 situation. So currently in the state of Florida, we have 114,018 positive cases with, unfortunately, 3,327 deaths. Here in Martin County, our number today at this time is 1,673, and with, unfortunately, 23 deaths. Our positivity rate currently right now is at 11%. So as you know, the Florida Department of Health maintains their dashboards where you can find this information. We do continue to see a couple of zip codes where we're seeing an uptick in cases, which includes 34956, 34994, 34997. And this data also, like I said, is on the Florida Health COVID-19.gov. So last weekend, the State Surgeon General presented a health advisory, which included encouraging the face cloth coverings and social distancing, encouraging high-risk populations to those 65 and older and with chronic health conditions to limit their exposure by, staying home and also wearing masks if they are to go out. Contact tracing, as you know, is our number one mission, working one-on-one with our cases and with those contacts to educate them and reinforce the importance of isolation and quarantining. At the time, the cases fall in the age range of 25 to 54, which I know you've been hearing a lot, and the median age for Martin is 38. So again, as we said, with those who are younger and generally healthy and faring much better than those who are older and may have chronic health conditions. So that's why we really are encouraging our young population to just be cognizant of the fact that this is helping to prevent our most vulnerable by wearing a mask and keeping your social distancing, helping to protect our most vulnerable, which can include your parents, your grandparents, aunts, uncles, etc. Outreach. So what we've done, especially in those zip codes, we're working very closely with our businesses. We're also, we put together a fact sheet for quick reference for information regarding reopening and such. We also are going one-on-one to these businesses to talk with them to see if they need additional education, masks, things like that. So that's what we're doing there. We also are working with our HOAs and meeting with the management team there and also the maintenance staff, providing education again and masks and answer any questions about, why it's important to follow these prevention initiatives. We're also working collaboratively with the University of Florida and the IFAS Extension to educate the agricultural, the nursery, and the landscaping employers and workers on the COVID-19 virus, and again, those prevention initiatives that would be helpful. Testing, we'll talk about some testing. As you know, Florida Community Health Center continues to provide testing in a number of their sites, one in Indiantown particularly Monday through Friday. We're out there at Warfield Boulevard, and anyone is able to go there for testing. Also, anyone that's experiencing symptoms, we know our colleagues Cleveland Clinic is providing testing there as well. So in closing, we know that this virus is very contagious, symptomatic, asymptomatic. That is why it's critical that we all together, practice those prevention measures that we keep speaking about every week. I encourage everyone to avoid the 3 C's. That's our new term. Closed spaces with poor ventilation, crowded places with many people, and close contact. So by continuing to initiate those prevention measures, we're protecting our most vulnerable. We're also helping to prevent the spread of this virus. Thank you.
Thank you, Carolyn. Does anyone have questions? Commissioner Campy?
Ms. Vitani, thank you very much. As the numbers have increased, I know that you've added to your epidemiology staff,
Yes, we have.
and they're the folks you're using to go out and do the contact tracing.
That's
Do you
correct.
find that based on the numbers that are coming in positive, that is it impossible to keep up with contact tracing as the numbers come in?
Well, that's a very good question. And yes, we just received additional staff today as well. And we have also looked at our processes, consulted with our neighboring counties as well.
Do you find pushback from people that when you reach out to them with the positive and then you start asking them questions about who is, we need to find out and trace through? Do you find that people are not interested in helping you and assisting with that, or is people open?
It's seldom that occurs, but yes, it does occur at times.
The staff that you said you were able to bring in, I think some people don't realize that you're not the Martin County Health Department. You're the State of Florida Health Department in Martin County, correct?
That is correct.
So all of your funding, your staffing, your decision-making, your marching orders all come from Tallahassee, correct?
That is correct.
So you're here this morning presenting to us almost as a professional courtesy because you're a member of the community, but we're not your bosses.
That's correct.
Okay, I just wanted to be clear because a lot of people have asked me about you should be doing this or you should tell them this, but you don't work for us.
That's correct.
Okay, thank you very much.
I had a question on the numbers, if they come in. I don't know if we have the chart for daily. Some days you'll see it up a little higher, and then some days you'll see it down in the 20s, and then 4 days later you see it, and that seems to be a common trend. So how quickly are we getting the testing back? Is that a true reflection of daily tests, or if you were testing in 3 days, would that come back?
Good question. Yes, that has to do with the labs, and it has to do with the labs entering their information into the state system and then it coming down to us. So as you know, with the different labs and with so much testing going on, I can't speak for the labs, but I do know that sometimes the labs will be a very quick turnaround, and sometimes there might be a lag in the turnaround.
What's the average turnaround now?
I would say anywhere from 3 to 5 days. That's what we're seeing.
So then the results, if we see on 625's results, those could be tests coming from 3 to 5 days ago?
Mm-hmm. That's true. And the other thing is that's why once we get those, once someone tests and we get those result, that's why we're calling them and telling them, whether they have to quarantine or isolate. And also, when they come for testing, many of the testing sites are saying until you get your results, you need to quarantine.
Right. Okay, thank you.
You're welcome.
All right, thank you.
Thank you.
Our next presenter is Rob Lord, CEO of Cleveland Clinic, Martin Health. Thank you for being here, Rob.
Thank you, Madam Chairman, as always. Commissioners, always appreciate the opportunity. The news on COVID across the country continues to be concerning. I'm sure we're all seeing the same things when we turn on the television. When we last spoke, or since we last spoke, we as a state crossed the 100,000 positive patient mark. For 2 consecutive days, Florida as a state has had more than 5,000 residents that tested positive. Cities across the state, of course, as we know, are considering, and Tampa and Miami, I understand, have mandated masks in public places. I was very concerned when I saw what happened in Texas yesterday, where they took the 4 largest cities in Texas and demanded or required that all hospitals, again, stop doing elective cases because of the demands on those hospitals. And our thoughts and prayers are with those people in Texas. Florida's not to that point yet. But we do continue to monitor the situation. I have this slide presentation. Next slide, please, ma'am. What we're taking, by the way, is, Madam Chairman, your question, I've tried to rely on state data here so that we're not creating any confusion. I think I can do that at times when I give my own data. I will, one slide, give our own data. But as you can see, last week I said something, I think last 2 weeks, about how Martin County had the dubious distinction of having more than the Indian River and St. Lucie County combined. That is no longer true. If you look at the trend lines shown on this graph, you can see that since the 1st of June, Martin and St. Lucie County's trend lines are almost identical. That being the slope on those lines. But if you look at Indian River, you'll see an uptick at the end there. They may be playing a game of catch up here. So it may have reached that next community. Next slide. We've talked about this, and I thought there's a different way to represent it. Again, this is Florida Department of Health data. We've brought it out and done some calculations with it. But looking at number of residents tested per 1,000 residents, this is quite impressive for Martin County. I mean, that's a significant number. You're looking at having tested right at 9% of your population. And that's better than most counties. I'd love to see it be 100%, but that is good. Again, I want to go back to this. Has been used as an explanation for why we have so many infections, positive tests in the system. If you can go to the next slide, this is where that concept falls apart. This shows you for everyone. This is the rate, the percent, again, out of every 100 tests done, how many come back positive. And you can see we are, Martin County is running well ahead. Palm Beach County is behind us, and Broward County is behind us. The green line is the state average. So if you average it across the state, and again, you can see that St. Lucie County has just crossed that line, and Indian River is running well below it. Next slide, please. To Commissioner Campy made a point. I tend to agree with it. One of the things we ought to keep an eye on is how severe is this illness? How many people are being hospitalized? And so you can see here that and this is as of, I think, the day before yesterday. I did these slides yesterday, so I used the most recent data I had, but it's not going to change substantially. But the next slide, we talked about this a little bit, or Carol Ann did. for people that at home and here that are thinking this is a disease for the elderly. Actually, I think our senior citizens have done a very good job of complying with the guidance that they've been given, better job than the rest of our citizenry have. But if you look at this, these numbers are very concerning for that middle age group. And I will tell you that the distribution of hospital cases skews a little bit towards the elderly, but we have an awful lot of young people in the hospital, or what I consider young people. What a man in his 60s considers young people. So those people that are in that 54 and down into the teens. Last week, we now have had some pediatric admissions. This is very concerning, and it's a reminder to us all that everyone is susceptible to this, and that we're susceptible to the serious consequences. To Carol Ann's point, we're able to keep those patients alive for the most part, but that does not mean they will not have long-term serious health consequences as a result of the damage that's been done to some system in their body, principally lungs, but also brain injuries, heart issues, other issues. Finally, next slide. This shows you our hospitalization census, and I'm sorry about the dates at the bottom. I've narrowed this down to just the month of June. Last week, I showed you a chart that was from, I believe, the end of March through today. But so it doesn't maybe stand out as much, but notice at the beginning of the month, we're down around 20. We're in the low 20s. And now we've consistently been, this last week, between 40 and 50. You see, the week before, we were between 50 and 60. And we had a couple of days there where we had great success and great celebrations discharging patients, because for us, that's a celebration. Every time we discharge a COVID patient, and particularly if they've been in an ICU or on a vent, that's something for our entire team to cheer on. But this data is still concerning. That's still a high number for our community, such that, as I'm sure we're aware, the governor chose to single us out yesterday in his press conference for having a very high rate. Next slide. Oh, there's no next slide. We can't let our guard down. We need to continue to do everything in our power to protect ourselves. And from the point of view of our organization and what we're requiring of all of our people is that we wear masks. If you walk in the hospital, we're going to know 3 things are true before you walk in the hospital: that you don't have a fever, that you have on a mask, and that the last thing you did before you walked in the building was you washed your hands. And I would encourage everybody else to try and take that approach. We continue to prepare for as many contingencies as possible and collaborate. And we believe we're prepared. We can handle this load of patients. But it's important that people know that this isn't a situation where you come into the hospital and we treat you with a cure. We try to manage your symptoms until you naturally get better and keep you alive. And there are some treatments, and I've been through those in a previous presentation. I'm not going to repeat myself. I have probably shared my opinions to the point that you know what they are. So I'm not going to belabor that point. But I would be, as always, more than happy to answer any questions you might have.
Okay, thank you. Oh, I'm sorry, I was looking for your
It's the
card,
beam-
not
it's
your
the
light.
beaming light.
Yes. Commissioner Smith.
Thank you, Madam Chair. Rob, would it be possible for the next report, and I think this would be helpful for us to communicate to the public and the press and so on, in that chart where you have the multicolor age group, the 15 to 24 bar through the 55 to 64 bar, can we get what that does represent relative to hospitalizations versus the really like the 65 to up category?
We have a sophisticated system that I can interface with our record, and I can pull that data by age groups. Now, the age groupings are a little different than what you see there, but I can give you that. That was in last week's report. So if we had that, I had a slide, I took it out, but I'll add it back in.
I think in the messaging side of this thing, that will be helpful, that if what the chart shows is that the increase in that age group is up significantly, that if we can say to the public, these are how, in the hospitalization side of it, out of the 155 that you were at yesterday, or whatever that number was, of that 75, 45, whatever, are in this age group, so that it's not viewed as being, my age group is immune to this and I'm perfectly okay doing what I want to do because I'm young, and all we've heard for 3 months is it really affects the elderly, or the more senior class, when clearly the data is showing otherwise.
I will put an amazing team of talented people on how we can best graphically demonstrate the age distribution of hospital admissions. Now, it may be, I may be able to easily break that down by county. It may be that I can more easily break it down by hospital, but that'll be okay with you?
I just think any kind of reference point I think would be helpful.
Great. I will come back with our best effort at that.
I have no doubt. Thank you very much. I appreciate it. Thank you, Madam Chair.
Great. No other questions? Thank you, Rob.
Thank you as always.
Okay, our next presenter is Carol Howard Dietz from the United Way of Martin County.
Good morning, everyone. Thank you for allowing me to be here to give you an update on our nonprofit community. As nonprofits continue to reopen and provide services, they are making sure that they're following the CDC guidelines, and the majority of our nonprofits are requiring their staff and clients to wear masks. An update on the food situation. We continue to monitor the demands on our system. During this pandemic, I can tell you you'd be proud of the providers that are working on the Recovery Task Force, because they have been able to keep food in our community plentiful and available to those who need it. The funding consortium, which consists of nonprofits, government, and corporate partners, continue to meet and review applications and that have been submitted from our local nonprofits to keep them strong during this pandemic. As we continue to discuss future issues that will affect our community on the Recovery Task Force calls, yesterday our biggest concern was the upcoming rent and mortgage moratorium that's ending in July. And our agencies are concerned about the demand that it will put on our system for those that have been delaying paying their rent and mortgage because there were no penalties, that come July, it's going to hit our community really hard and our service providers. So I'll keep you updated on how that's affecting our community. We continue to coordinate and track volunteers that are specifically related for COVID throughout the community and assist where help is needed most. Currently, we are grocery shopping and picking up prescriptions for about 30 seniors in our community who are self-isolating due to their fears of the virus. If there are any seniors out there that need that service, please call our office and ask for Kathleen. She's going to hate me for doing that, but she has really been coordinating volunteers to go out, go grocery shopping, pick up prescriptions, deliver it to our seniors, and it's a really wonderful thing. I'm sorry, 772-283-4800. That's the United Way office, and Kathleen is the person. Others who are looking for assistance, 211 is the number. If there's any questions, I'll take them.
Questions? Thank you, Carol, for
Thank
being
you.
here. And we're going to have a presentation now by Mr. George Stokas on the CARES Act.
Mike, do you want to just work the slides for me, so you don't have to get up and move? Good morning, Madam Chair. George Stokas, Assistant County Administrator, for the record. We're here this morning, the staff is here to present to you. We have, if you can go to the next slide, Mike. We have been granted access to the CARES Act as of late Tuesday, early Wednesday morning. I want to just set down some guidelines as to what CARES is and what CARES isn't. CARES is not a grant. We did not just receive a bunch of money and then to do whatever we'd like to do with it. It's really more of a reimbursement account. The total amount of money that we did get from an initial slug of money was about $7 million. with the ability to get up to $28 million, but it has to meet an eligibility list of reimbursements. So the difficulty here with CARES is, unlike other grant programs or other reimbursement programs, there are really no formal documents in which to guide us. And we see this across the state through the Florida Association of Counties. There are really only 2 frequently asked question documents that have been put out by the U.S. Treasury Department that are supposed to help guide states and then ultimately local counties as to what's available to spend, how you can spend it, and the efforts in which it will be audited. And that also takes us to the next bullet, is some of our concerns. We do have to meet a single audit requirement for this money. There are some questions. Those of you who are familiar, we have done stuff with FEMA, and FEMA has a certain level of auditing, whereas we believe the Treasury may not be as extensive as FEMA, but we do believe ultimately both agencies are governed by the General Accounting Office or the Inspector General's Office, so we feel that the auditing will be very similar. In order for us to pass single audit requirements, we do have a memorandum of understanding, certified backup, affidavit of records, and we do review the anticipated eligibility expenses. Again, no formal guidance has been established, and even as we finish this presentation, there is still some questions that will occur, and this is where I usually like to put in my little rider that this can and probably will change every 15 minutes as things come out. So next slide, please. When you're looking at the CARES Act program, you can break it down into 5 simple pieces. The first piece is small business assistance, second piece mortgage and rent assistance, third piece utility and personal needs, fourth is municipal and constitutional officer reimbursement, and then 5 is private hospital reimbursement. The important thing to remember when looking at all 5 of these programs is that the U.S. Treasury says that if there are other federal aid programs, our aid program could not assist these other programs. So as I go through, I'll kind of point out some of these differences and clarities. Next slide, please. The first one that's mentioned by the U.S. Treasury is that the county can create a small business assistance fund. I put up the purpose there, but basically it is to assist small businesses or businesses in general. Staff looked at the Palm Beach County model. The reason we've looked at Palm Beach County model is because they got their CARES funding much earlier than we did, and staff believes that if Palm Beach County's funding was approved and they were able to do it the way that they did it, ours would also be approved. Palm Beach County, not to go into the major criteria, but basically the gist of Palm Beach County's business package was businesses would not receive more than $25,000. They could not be publicly traded. They could be an S Corp, C Corp, sole proprietor, an LLC. Also, if a business had received PPP funding prior, they did not qualify for small business assistance because that would be considered double dipping under the Treasury account. What staff is recommending at this point, and up for discussion and direction, is that we would create a program similar to Palm Beach County. However, rather than just handing out money, we would use probably the Treasure Coast Regional Planning Council to administer a program in coordination with their SEDS committee and the BDB that would provide assistance, but also technical support. For example, if you're a retailer and you wanted to get a grant, you would also have to work with a merchandiser to assist in your business. So it's not just a check that helps them get through maybe 3 months. It's a process and a program and a check that hopefully sustains and enhances their business. However, staff does recognize that this board did direct us, and we are in the process of working out the economic impact study for COVID, and that impact study will be covered by CARES money. Because we're relating it directly to COVID. So that's our 2 recommendations for small business assistance. And Madam Chair, I don't know if you want me to stop to answer any questions, or I can just move right through this. I only got a couple more slides.
Go ahead and go
Okay,
through the
next slide.
slides, and then we'll take questions.
The next program is mortgage and rental housing assistance. Basically, the 2 purposes of this is to assist individuals that are coming under that out of that moratorium from foreclosure and eviction on August 1st. As you heard Ms. Carol House-Dietz talk about with United Way, as well as it's to assist individuals who are homeless or become homeless. So for an example, we know there are individuals that live, that are maybe room tenants in housing, And when they are found to be positive, that their roommates kick them out of the house, we would work on transitional housing so that person wasn't couch surfing. More than likely, we would put them up in a hotel or so on and so forth. It's to assist in getting rid of homelessness. Both of those type of programs are covered under the CARES program. We would recommend that United Way administer that program because they already have a program in place and they can better address the needs of the community and what I like to call what I understand is the ALICE population. If you were to go more of a federal route, you start dealing with the issues of 125% below poverty and you start not helping the individuals that actually are really affected by COVID. The second part of the program with the transitional housing, we would recommend Health and Human Services administers that. We've already got a program in place, and we would work with our not-for-profit partners through the United Way to identify those individuals and provide them assistance. The biggest question now, actually, with this program, though, is the governor announced very late yesterday that he will be pushing money out, about $120 million, for mortgage and rental housing assistance. So we are looking into whether or not we can do this program and have the governor's program. But right now, staff kind of believes that we can still do this program because we're the most local form of government, so we could probably provide the most beneficial benefits. I wish I could think of a better word for that, but we're studying that. But that is an example of what the complications are and trying to make sure people aren't able to double dip so that we can pass auditing purposes. Next slide, please. Next program is utility and personal needs assistance. This is really your utility payments, and sad to say, in some states they did make a program available for those individuals where unexpected funeral costs were incurred. I don't know if that will be such a large issue here in Martin County, but those are the type of programs we're recommending. Again, we're going to work with United Way. We also have some established programs in Health and Human Services. Your eligible expenses are really electric, water, sewer, and gas. And again, personal expenses are funerals, and that's up to board direction. Next slide, please. This is probably the largest program you'll be facing, and that is a municipality slant constitutional office reimbursement. And this is to assist with your municipalities and your constitutional offices in recouping the costs that they had spent in COVID-19 and reacting and working the COVID-19 issue. To be blatant, the CARES Act does not require that you give a single dime to constitutional officers or municipalities, but however, staff believes in the spirit of cooperation that we probably should do this. We are recommending we hire an independent accounting firm to assist us in managing this program and to create more of a general objective view as to how reimbursements are judged. Again, we have created a reimbursement account to which municipalities and constitutional offices can apply. They would have to enter into a memorandum of agreement, which we've already created, provide a certified backup, which we've also created, execute a reimbursement certification as well as a certification regarding lobbying. The most important thing to remember here is as we're handing out money, if that money is found not to be eligible post-distribution, we have a clawback provision in our MOU and these type of documents, because ultimately the state has said to us, if the money is not eligible, the county is responsible. So we have these documents, and if the board directs us today, we can execute all those documents and send them out to the municipalities by this afternoon. I have spoken with a couple of the municipalities and have been in contact with them. They are, we do know that they have some costs. I think your biggest constitutional reimbursement will be with the sheriff's office because of the labor that he's put into reacting to COVID. Also, this money can be used from March 15th until December 30th. We have to spend we would have to only be eligible for reimbursement until December 30th. So next slide, please. And then finally is the private hospital reimbursement, and probably is the most tricky for us to deal with. There is a language in the CARES Act that does allow the county to help reimburse private hospital systems. We are really at a point recommending with Cleveland, we want to talk to Cleveland Clinic and talk about possible reimbursement options and come back to you at a later date for that. Because again, the problem is CARES money cannot be used if other federal money is being appropriated. And we believe that there has been some accounts set up for hospitals that probably covers some portion of their costs. And we want to be very careful as to not create an audit issue and so forth. And with that, Madam Chair, that is my presentation. I'm more than happy to receive some direction as well as to answer any questions at this time.
Thank you, Mr. Stokas. I see a couple lights. Commissioner Campy, some questions?
Thank you, Madam Chair. Mr. Stokas, thank you. I think a lot of us have been waiting to see how that was going to shake out. There was some confusion when larger counties that had a population of 500,000 or more were able to get their money directly from Washington, and smaller communities and counties had to wait to get the money to go to the state and then find its way down. So it seems to be finding its way down. I appreciate the presentation. I know that the people that are struggling financially have waited to go from Washington to Tallahassee to Stewart. I'd hope that now that it's arrived in Stewart, that we can utilize your recommendations and move it through very quickly. So to get the ball running, I see my colleagues have lights on as well, but to get the ball running, I'd make a motion that when it comes to the business category, that we take your suggestion, a staff suggestion of the Regional Planning Council and the BDB. I think that gives you both a regional and a local feel for what's happening, and that way we don't have to reinvent the wheel and create a group to then formulate these people that are struggling for the finances, especially small businesses, can use the money faster than later. Sometimes it's the difference between staying in business and not. The housing and utilities, you sort of bunch those together with United Way and Martin County Human Services. Again, those systems are already in place. They're proven. We don't have to worry about, will this work or won't this work, or wait for them to invent a system. It exists. I like the concept with the independent accounting firm for municipalities and the constitutionals, so that it doesn't look like there's any kind of, inside deal. I wouldn't want our administrative staff at the county level to have to be responsible for deciding what happens in Sewell's Point and Ocean Breeze and Jupiter Island, City of Stewart, Indiantown, or our constitutionals. I think an outside accounting firm is an excellent idea. And then finally, the hospitals. We already have a group that Commissioner Jenkins and I sit on. It's the Indigent Healthcare Review Board through county administration. You sit on it. You're attended at least with us, Mr. Stokas. I don't know if that's exactly, the concept is similar, where we assist. The hospital has a budget where they, write off certain expenses for people that meet the criteria. I think that criteria would be similar, but I agree with your concern that there are funds available for some of that. So we at least want to educate people that were struggling to pay hospital bills. We know hospital bills are like a punch in the face if you can't afford to pay them or don't have the proper insurance. But what we have seen with that board that I sit on is sometimes people get caught up in the paperwork, caught up in deadlines, caught up in not meeting the information that is required, and then don't get the opportunity to get the money. So I think that one in particular requires a lot of information be given to the people that could possibly participate. So thank you. I think we're off to the right start. I'd just like to make sure we get the money distributed as quickly as possible to the people that need it and proved they should get it. Thank you.
Commissioner Smith.
Thank you, Madam Chair. I'll second the motion for discussion. George, first and foremost, thank you, George. I think articulating that as clearly as you did and not looking at your notes that often was pretty good, actually.
Well, I need to thank, I also, not to interrupt you, Commissioner, I would be hesitant. There has been at least 20 to 30 staffers that have assisted me in this, and to sit here and name won't be long, but they know who they are, but they've done a really good job in helping us.
And I have no doubt, and thank you to all the team. Additionally, an additional thank you to the National Association of Counties early on in the CARES distribution of funds when it was clear that the funds were going to the 500,000 plus communities. NACO, National Association of Counties, stepped in a major way and redirected the congressional efforts that were moving in terms of how those funds were going to be allocated, and that mid-small counties also needed to be in that mix. Cities need to be considered, and the balance of where those funds were split between cities and counties. In the early stages of all the negotiations were not in favor of the counties whatsoever. So kudos to NACO to getting that back to a split that was palatable to all of us, and has really, quite frankly, led to us getting at least in line for the funds that George talked about. The only other thing I would add to Commissioner Campy's excellent, I think, motion is that additionally to the accounting, the third-party accounting, George, on the auditing end with Carolyn, with the clerk's office, we probably also ought to engage an auditing firm at some point, whether it's independent or somebody she's already working with separate from the accounting firm, because I believe all of this stuff, a year from now or whatever, we are going to be, like we do with FEMA reimbursements, we are going to be challenged to prove that we did all the right things, regardless of having a third-party accounting firm and so on. I suspect there will be a lot of back-checking in the future. And so to the point that we can both have the accounting end independent of us, but I think also someone clearly aligned to make sure that there's a third party looking at that work would be probably prudent for us as well.
Yes, Mr. Commissioner, we have enlisted, I've talked with the fine folks at OMB, and we are enlisting the services of our single audit, our existing on-staff or on-contract single auditing firm that does a lot of our audits already. So we're feeling absolutely good recommendation.
Great. Thank you. Thank you, Madam Chair.
Okay, thank you. Any other comments?
Yeah,
Commissioner Hurd?
yes. When CARES funds were first approved, distribution immediately, not surprisingly, became problematic. It looked like it was difficult for businesses to receive grants to even apply, and it looked like big, savvy corporations got gobbled up an awful lot of money very, very quickly. So we want to make sure that we don't have those distribution problems with our initial $7 million. So how do you determine what percentage of that initial reimbursement grant is going to go for small businesses? What percentage is going to go for municipalities?
Well, Commissioner, what staff has kind of looked at is what some of the other municipalities have done. Palm Beach County appropriated about 23% of their total CARES budget to small business assistance. Their eligibility requirements, so to answer part of your question is, I believe staff would look at those. I would need to also look into like Orange County. There were only about 4 or 5 counties that got direct subsidy in like one city, so I do need to do some more research to find out those percentages. But right now, if you were to ask me, I would say probably about 20% of our total CARES funding reimbursement should, if you wanted to be in line with the other county to the south of us, would be about where we would recommend for you. But I'm more than happy to come back at the next COVID meeting that we have and try and create a graph and show you where we're at percentage-wise, as well as a better eligibility and go more in depth. But what I can say is that Palm Beach County had similar concerns to what you're expressing. So businesses that were capped at $5 million in total gross receipts, they couldn't be publicly traded. You had to be a for-profit business. You couldn't be a not-for-profit business. So we can bring you those eligibility requirements at the next COVID meeting, but I believe sitting here today, that's probably the way we would go because it seems to be a proven track with the Treasury Department, but the discussion as to what percentage is completely up to the board's direction.
And also, there's a recommendation that Martin County, for the municipal distribution, that Martin County hires an independent accounting firm to manage. Can we use these grant funds to pay for hiring that independent?
Absolutely. All administrative costs directed with this reimbursement program would be reimbursable. So when we do recommend, like United Way, there would be a negotiated administrative fee as a part of the program, as well as the firm that the general accounting or general management firm would also be covered.
Okay, and also Martin County has also incurred considerable expense as a result of COVID-19. Are we eligible to apply for reimbursement through this?
Absolutely, and we intend to.
Okay, good, thanks.
Any other questions? And Mr. Stokas, just to clarify, so included in Commissioner Campy's motion, you'll be bringing back the guidelines and eligibility requirements for businesses?
If the board would like and you pass Commissioner Campy's recommendation, my understanding is I will come back at the next COVID meeting and I will lay out all the programs eligibility and I will make sure staff is here to answer any questions you may have to proceed further. And I also consider today the opportunity for me to reach out to those entities listed and make sure that they understand, and we'll come back with more specifics, and I hope to have that to you in paper before the meeting.
Okay, thank you. We have a motion on the floor by Commissioner Campy, seconded by Commissioner Smith. All those in favor? Aye. Aye. Any opposed? The motion carries unanimously. Thank you, Mr. Stokas. Thank you. 4-0 with Commissioner Jenkins absent. All right, that looks like all of our presenters, so we're going to move on now to public comment. Do you have anything you just read in there?
Just before prior, let me make my little speech here. So we are currently in what we refer to as an election season. We have county commissioners that are in active campaign for re-election. Public comment is to address the Board of County Commissioners as a whole. We do not allow partisan politicking, which is defined as advocating the election or defeat of a particular candidate. Use of words, dates, signs, props, and/or wearing apparel or a nameplate that convey a message expressing advocacy for a person or group of persons is also not allowed. Thank you for your cooperation, and we have 3-minute limit on your comments.
Okay, thank you. Our first public commenter is Robert Ranieri.
Good morning, Commissioners. Rob Ranieri, House of Hope, for the record. Just wanted to point out a process we've got in place with your Emergency Operations Center and the Health Department, where when families are diagnosed, a member of a household is diagnosed with COVID, and they're urged to quarantine, we have a whole process in place to be able to get that family food assistance to hopefully keep them in quarantine and also make them aware of eligibility they may have for financial support as well. And I point that out because with the rise in numbers, one of the concerns we've had was that some of our lower income families are dependent on that paycheck, and so they're sort of, our fear is they would ignore a lot of the health recommendations and put a mask on and continue going to work. And one of the challenges we would have, obviously, in trying to get our arms around the spread and the growth of COVID. But this week alone, a positive thing, we've had almost 30 families that came through the system and were assigned to us from your EOC, and we were able to get them groceries and supplies that they need to stay in quarantine. Your emergency operations team does a great job with providing us that information. Fire rescue in proper protective gear delivers those groceries, so it's a safe process, and we continue to do that. And I think it's important to note that because, instinctively, if any of you or most of your listeners were to be diagnosed, your first reaction would be immediately to shut down, stay in your house, do what's best for your family, your health, all those good things. Our lower income residents and neighbors are not always in a position to do that. So they're taking some chances that are not in the best interest maybe of public health because they need that paycheck, they need to pay their rent, all the things that go with that. They're generally hourly employees and they can't really afford to miss work. They don't have sick time, vacation time, things like that. So that's one of the ongoing challenges, and it's been a struggle, I think, through this process. But again, like I said, this week, what we view as a positive is almost 30 families took advantage of that and are staying home. So I would urge all of you, if your offices are contacted, please direct people into your system through the health department and the EOC so that we can try our best to keep them quarantined, provide them with everything that family needs around food, financial assistance opportunities, all of those things to keep people housed and healthy and safe, and also to limit the spread of COVID. Thank you.
Thank you, Rob. Mona Leonard will be next, and Mona will be followed by Dr. Robert Hess.
Good morning. So a little background. I've been a resident of Martin County for 40 years. I ran 2 respiratory therapy departments at Martin Memorial Health Systems for many years, 2 arterial blood gas labs. The numbers that we're seeing are cumulative. What happened to flattening the curve? We don't see the curve anymore because we're just seeing this constant upward trend. It's deceiving, in my opinion. What are the numbers of new cases And I also would like to ask, what is the financial benefit for Cleveland Clinic and other hospitals to report a patient as having COVID? What is their reimbursement? Is it higher? That creates a problem. It creates an incentive for the medical community to add cases. Of course we're having more cases. We're testing more. We're going to have positives. We're going to have people of all ages that test positive. It's not so much the age group as it is where is the actual morbidity rate? What age groups are the morbidity rates in? And most of them, I believe, are older or they have comorbidities that are causing the deaths. I've been a lifelong asthmatic. I come from a family of asthmatics. I will not wear a mask. I don't believe in wearing the masks. I think you have a false sense of security by wearing the masks. And you actually reduce your oxygenation, and it's been proven. Oxygen saturation is diminished when you wear a mask. So people that already have lung issues have more problems wearing the masks. If you will use universal precautions, please look it up. It is universal. It is throughout the world. Social distancing is great. Frequent hand washing, avoid people who are sick. This is a droplet virus. That means it comes out. If someone coughs, it comes out and it drops to the ground within just a few seconds or whatever surface is around. Even Dr. Fauci is now warning and asking that warnings be placed on masks, that the masks do not prevent getting COVID-19. Mark Twain said, there are lies, there are damn lies, and there are statistics. I want to know how many deaths are caused in the county by other morbidities, other comorbidities in these numbers, because they're lumped into the COVID numbers. The test, I said that, the testing positive. There are less auto deaths now, so we can make up for that, because nobody's on the road, thus the rebates for
Ma'am, your time's up.
for
Thank
that.
you.
Okay,
Thank you.
thank you.
Okay. Our next speaker is Dr. Robert Hess.
Dr. Bob Hess, nursing leader, written a couple of books, couple hundred articles, retired here, 45 years as a registered nurse, and a registered Republican my entire life. More than 75 years ago, my dad landed on Utah Beach on D-Day. The entire country had mobilized to defeat an external enemy during World War II. Our country is now engaged in World War III, fighting against a global pandemic that's infiltrated every part of the world, including Martin County. In fact, national media has identified Martin County as one of the hot spots for COVID in the United States. And while I applaud your decision last week mandating mask wearing for all employees of restaurants, bars, supermarkets, and other retail establishments, I feel we have not gone far enough to make a difference. We've not mobilized all the resources we need to win this pandemic war. First of all, I know that some businesses are not complying with having employees wear masks. This requirement needs to be enforced with fines and other penalties associated with this noncompliance. Second, this week I ask that you extend your mandate to require that all clients and patrons of commercial establishments wear masks as well as practice social distancing. If both customers and employees had to wear masks, it would be easier for businesses to comply. These mandates should remain in place until we can quantify a drop in COVID-19 per capita rates and not just numbers. I know that mandating masks for all people in commercial establishments is a doable and effective strike at the worsening COVID pandemic here in Martin County. Some people will tell you that mandatory masking is an infringement upon their civil liberty. In my humble opinion, your rights end when they hurt fellow citizens. It's a small sacrifice to put on a mask when patronizing local business establishments. We've mobilized when threatened by enemies outside the country, Let's do the same here against this enemy within. Optional has not worked. Masks, simply a preventative public health measure, should not be politicized. You folks have the power. Please use it to ensure the health of people in Martin County by requiring that masks be worn by both employees and patrons of commercial establishments. Thank you for your time and a chance to voice my opinion about this.
Thank you, Dr. Hess.
Thanks.
We have, the next speaker is Meredith Lee, and Meredith is going to be followed by Johnny Colson.
Good morning, and thank you for giving me the opportunity to speak as to why I'm against mandating masks for the public. So I'm happy that I got to follow Mr. Hess here. Number one, as a sufferer from asthma, it actually worsens my condition. I cannot breathe when I'm wearing a mask. As a human being, I have a right to breathe fresh air. 1 in 12 adults have asthma according to the American Lung Association. This obviously does not include other chronic respiratory illness, which would have a negative impact on this person's health. Will those that cannot wear masks be shamed by others because it's the expectation? Will they have to constantly disclose their private medical information? Will they be kicked out of stores because they have a medical condition? Sounds like a lot of violation going on to me. Number two, PTSD. An estimated 70% of adults in the United States have experienced a traumatic event at least once in their lives, and up to 20% of these people go on to develop post-traumatic stress disorder, or PTSD. Wearing a mask is a trigger for many people. This is very common for trauma survivors. Will this personal and private reason have to be disclosed at every store and to every person enforcing this mandate just so these people can buy food and clothing? Do we have the right to privacy? Number three, what about the deaf, the autistic, those with sensory disorders, and your regular toddler? Would you really expect for these adults and children to wear masks every single time they are in public, which is already a challenge for them and their parents and families? Expect litigation if this ever passes. It is not right. I'm going to skip that one because I want to make sure I get what I really need to get in. Next, I am not comfortable with the government making medical decisions for me. This is against my civil rights of body autonomy. The only fact we know about COVID-19 is that we don't know much about COVID-19. The narrative has changed so many different times. Dr. Fossey said that masks were a false sense of security. Recently, he has said that that was a lie, that he outright lied to the public because whatever his reasonings were, I don't even know. But at that point, he's lost credibility in my eyes. We've been told different things over and over again. So what the most apparent thing about COVID-19 is that it is benign for the majority of the population. 40% of people don't even know they have it. That 20 to 40% per Dr. Fossey. Where does the government overreach end? Is it not the government's job to make medical decisions on behalf of its citizens? When will the mandates end? Since when do I not get choice over my body? And lastly, how is Martin County prepared to enforce a mandate? Will law enforcement be involved? Does MCSO really want to enforce this? Does the sheriff? Do we really want to waste precious resources on this?
Ma'am, your time's up. Thank you.
Thank you very much for letting me share.
Okay, our next speaker will be Johnny Colson. Johnny will be followed by Christy Mihawk.
Johnny Colson. I don't know where to start. Fear and gullibility, that's how our government, our leftists, try to control us, along with our biggest pandemic in the United States is our news media. Wearing a mask is illegal if you have a concealed carry permit. You cannot be out in public with a concealed firearm and wear a mask. It's just, that's the way it is. I'm not giving up my Second Amendment right and my right to carry because some politicians decide they're going to listen to everybody that has an iron in the fire to make money off of this thing, listen to them and go by them, their opinion, rather than the ones that elected you and put you in this office. You are here to represent us, not them. You are here to do for us, representing us to higher government, but getting things from us. You work for us, so please do the right thing. The way they control it is the way I call it, is gullibility and fear. You tell them something, they believe it. They're scared. Now you have control of your sheeple. So I just ask that you, when it comes time to do a vote on this thing, recommend it maybe, mandate it definitely not. And I'd also like to thank our Sheriff's Department, all of our law enforcement here in Martin County, as well as our nurses, fire rescue, for doing a wonderful job for all of us year-round. Thank you.
Thank you. Thank you, Mr. Colson. And we have, our next speaker is Christy Mihawk. Christy will be followed by Anna Rosenbaum.
Good morning. Thank you for letting me speak. I'll try and be fast. I want to address the mandates for masks. I'm against that.
Ma'am, can you pull the mic down? It's hard to hear you.
Can you hear me now? Okay, that's better. In the United States, the doctrine of bodily autonomy comes from the right to life, which is written in the Constitution. This is furthered by Section 1 of the 14th Amendment. It reinforces that the state cannot deprive any person of life, liberty, or property without due process. The definition of this, to be specific, the principle of bodily integrity sums up the right of each human being, including children, to autonomy and self-determination over their own body. It considers an unconsented physical intrusion as a human rights violation, as do I. Let me go to the Second Amendment. Provides U.S. citizens the right to bear arms. Chapter 876, Section 12-2011, Florida. No person or persons over 16 years old of age shall, while wearing a mask or device whereby any portion of the face is hidden, concealed, or covered as to conceal the identity of the wearer, enter upon, be, or appear upon any lane, walk, alley, street, road, highway, or other public way in this state, which takes away, if these masks are mandated, completely takes away our Second Amendment right to have a conceal and carry a weapon, just like that. And I am totally against that as well. Violates our Equal Protection Acts. Many people have physical illnesses that you're not aware of. It's already been mentioned, asthma, upper respiratory infections, which I actually have from doing nails for years. I can't ever do that again. And I shouldn't have to disclose that to anybody, ever. I can't wear that mask I can't even handle, I don't wear a mask, I wear something to pull over my face. But I get Instacart because that's what I choose. I don't want to make people feel uncomfortable. And I cannot even believe how many neighbors are turning against each other because of this. People aren't friends anymore. This is causing so much dissension. Besides the fact that it's a violation of our rights. It is. If we're mandating masks, we should have the choice to make that decision. And I think most of us are trying to do that and be respectful to each other. I give people space. I don't want to, I don't go to the grocery store, I Instacart because I don't want to frighten older people, but I don't want to be made to do that. And so that's all I have to say today. Thank you very much for listening.
Thank you. And our next speaker is Anna Rosenbaum. This is the last public comment form I have, except for online. So if anyone would like to speak, please fill out a form and give it to the bailiff.
Thank you. Good morning. I'm Dr. Anna Rosenbaum. I'm a physician from Martin Health. I spoke last week. First of all, I wasn't planning on saying this, but I think it's important for physicians and scientists to counter misinformation in the community about masking. Masks do not reduce your oxygen rate. If that were the case, we'd have surgeons, falling over every day they wear masks for many, many hours. The virus is also not just a droplet virus. It's an aerosolized virus. There are studies that show that it remains in the air for up to 3 hours after someone is in the room. So it's not just little drops that fall to the ground. But I think it's important. I know there's a lot of disinformation in the community, and it's important for us to know that masks are not dangerous. Anyway, everyone knows the burgeoning numbers in Florida. We've gone 3 days in a row with 5,000 new cases. There was a study that came out the other day from the University of Washington that showed that masks themselves reduce infection rates by 30 to 50%. So we've had in Martin County 1,460 cases. Up to half of those cases would have been prevented in public by masking. We've had 10 deaths. We've had 20 deaths. 10 of those people might still have been alive today had there been a mandated public masking policy. Last week, I applaud you. You took the step of mandating masking for employees in stores and businesses. Unfortunately, it's not sufficient to do that. The reason why is because community members who are potentially infected are coming in and out of those institutions in enclosed public spaces, and they are a source of infection. One thing that's interesting to know is that for every one infection, there are 10 other people infected. So Mr. Lord got up earlier and said there was about 74 out of 1,000 for Martin infectivity rates. That means there are about 12,580 other people in Martin County who are walking around infected, and many of those people are not wearing masks. I'll finish with this. Yesterday, we had a very grim milestone at Martin. We admitted our first baby with coronavirus. I can't speak any more about that patient for privacy reasons, but pediatric cases are rare, right? So they're rare, they don't happen very often. To the extent that we've seen one, that tells you how widespread those public infections are. Okay, and we know that 50% of those infections may be asymptomatic, but you can still transmit. Unfortunately for children, pediatric cases can get a systemic inflammatory response, and about 50% of them require intubation, and 50% of them may go into shock.
Ma'am, your time's up. Thank you.
Thank you for letting me speak today.
Thank you. Okay, we're going to move now to public comment that was submitted online. And how are we? You want to do Zoom first? Okay, so we're going to go through Zoom public comment with Mr. Merker.
Good morning, Commissioners. I am going to first, we have two speakers that have asked to speak. First, Carol Brennan. Carol Brennan.
Can you hear me?
Can now, yes.
Thank you. Good morning. I had hoped to be there in person, but appreciate the opportunity to attend via Zoom. My name is Carol Brennan. I'm a physician and have a graduate certificate in public health through the University of Florida. I've been following the SARS-CoV-2 virus since it was a footnote in medical news about a novel viral genome that might be responsible for a pneumonia outbreak in China in early January. How things have changed, and more is being learned every day. Just yesterday, the CDC added pregnant young women to the list of high-risk groups because they are much more likely to be hospitalized and require ventilator support. Reasonable people do not need mandates. They are informed by science and motivated by altruism. They are the people already wearing face coverings in public when they can't social distance in order to protect themselves and others. Unfortunately, there are not enough of them. People who are not reasonable are motivated otherwise and need mandates to do the right thing. We have seen this with speed limits, smoking in restaurants and on airplanes, and plenty of other situations. Reasonable people in Martin County implore you to require face coverings in public for all residents and visitors when they cannot physically distance themselves. Of course, with appropriate exemptions as indicated on the CDC website and in the State Surgeon General's advisory from June 22nd. There is no other way to significantly decrease community transmission at this point. The governor has encouraged face coverings, but unfortunately has put the onus on you to call the shots here. The State Surgeon General extended the public health advisory on Monday to include face coverings in public for all, but he needs you to make sure it happens here. Earlier this week, Palm Beach County mandated face coverings in public. A few weeks ago, you were very worried about Palm Beach residents coming to our golf clubs and beaches because theirs were closed. Are you equally concerned they will come to Martin County to shop and eat in restaurants because they don't have to wear face coverings here? Please mandate face coverings in public for all with appropriate exemptions today. Thank you.
Okay, thank you. We have another public comment on Zoom.
We have one more, Commissioner, and it is someone who has identified as iPhone 7 Steph, so we want to make sure, Steph, that you please state your full name.
Can you hear me?
Yes, so please state your full name before you comment.
Yes, my name is Stephanie Jenkins, and thank you for your time. I have the biggest concern with the who can get tested once you get your results, once you find out you've been exposed. The amount of confusing information that is being received is, if you go to an urgent care, they will tell you if you have a positive case, your whole family needs to get tested. If you go through a drive-through, they will tell you if you've been exposed to someone, you can only get tested if you have symptoms. And then the second part is, when can you stop self-isolation? Okay, so if you're positive, then you can come out 3 days after your fever has broken and your symptoms have improved. What happens to the 10 days and the 14 days? I've called CDC, I've called the Martin Health Department, I have called the nurse triage line, and that I think is the most concern in making the public more aware so there is a uniform idea of what is to be done if you've been exposed, whether you're negative or whether you're positive, because there's a lot of us in Martin County that either are positive or know someone who is positive, and we're all being exposed. So what is it that you want us to do? Stay home for 14 days, only stay home for 3 days? The amount of people I've been speaking to, we all have different responses from those municipalities, and I think that's the biggest concern aside from face masks. And I thank you all for all your time and for all your hard work, and I know it's not easy making all of these decisions, so I appreciate your time.
Thank you. Is that all of our Zoom public comment?
That is, Commissioner.
Okay, we're going to move to our submitted public comments. And who wants to lead, Mr. Stokas or Mr. Merker?
Madam Chair, we'll let Mr. Merker lead, but we'll be alternating.
Madam Chair, before you begin, gentlemen, can you tell us how many public comments you have?
We have approximately 60.
60 public comments, just so people that are watching or here understand we have 60 public comments.
6-0.
6-0.
Madam Chair, I'm going to have to leave at like 10 to 11, so just, I don't think we'll get all 60 done in that time. I'll have to leave.
Okay, so we're going to do our best.
Commissioner Smith, will you not be returning then?
I will not be returning.
Okay, just for clarification.
All right.
So, excuse me, our first comment is from Thomas Pine. Where should our tax dollars be spent? The storm that devastated Hobe Sound and brought large amounts of flooding to many neighborhoods throughout Martin County should not have been a big surprise, as the county commissioner that represents Hobe Sound and the county commissioner that represents Palm City both stated that these neighborhoods have had flooding problems for decades, like many other neighborhoods throughout the county. So why has this been going on for decades? Because the people in power are more interested in their own dreams and wishes than taking care of business. I am one of many taxpayers that think our tax dollars should be spent on the needs of the community, such as fire rescue, police, roads, sidewalks, parks, water, sewer, drainage, trash collection, et cetera, et cetera. Over the last several years, the county commissioners have tried several times to raise taxes in two different ways. Twice they tried to raise the sales tax, and we, the taxpayers, voted no. Then they tried twice to pass a fire assessment tax, and we, the taxpayers, stood up loud and clear against it, and the commission voted no. The fire assessment tax is especially dangerous to the taxpayer because once it is passed, there is no cap as to how high the commission can raise it. Unlike the sales tax, any increase in the sales tax has to be approved by the taxpayers. These attempts to raise taxes were, and I quote, for infrastructure. Some of the questionable spending is strongly tied to good old boys and the pay-to-play crowd. the illegal expansion of runway 12/30 at Whitman Field, the water park, the mooring field. The latest boondoggle is the clubhouse at the county golf course, and let's not leave out the millions and millions of local tax dollars we dump into the Atlantic Ocean at Bathtub Beach every year. The county employee that oversees this seems to think that if we dump enough money in the ocean, we can beat Mother Nature. It reminds me of an old TV show, Are You Smarter Than a Second Grader? We filed. These are just the largest of the dreams and wishes that stick out to me. These are our tax dollars that should have gone into infrastructure.
Thank you.
Next comment is from R.J. Pazzi. I prefer dangerous freedom over peaceful slavery. Thomas Jefferson. That government's best, that which governs least. Henry David Thoreau. You're up, Mike.
The next comment is from Pam Arthur. Please vote to make people in Martin County wear face masks. The numbers of people in our county and all of Florida with COVID-19 have been skyrocketing. Wearing masks is the best way to prevent the spread of the virus. George?
Next comment, Tiffany Weekly. My name is Dr. Tiffany Weekly. I am a local physician and the president of the medical staff at Cleveland Clinic Martin for the past 4 years. We met on 6/12 when I addressed you as the medical staff president. Today I address you as an independent local physician, a resident of this community, a wife and a mother of a school-age children. 2 weeks ago, there were 2,317 cases on that day in Florida. Now that number has more than doubled to 5,028. You spent 1 week and 3 meetings to decide to pass a mask policy. It is woefully inadequate, but I understand why. Because humans will always take the path of least resistance and hope for the best. It is why the governor won't make a policy, why individuals blind themselves to hard truths. We react instead of responding. We are fixing a problem instead of preventing it. So here you are today with COVID-19 in your lap and a local positive percentage rate so impressively high that even Governor DeSantis mentioned Martin County in his press briefing yesterday. I challenge you to take the helm of leadership this time and have the courage to set a universal policy whereby everyone practice physical distancing and wear cloth face coverings for the foreseeable future until such time as we have an effective vaccine, with exception granted to those medical contradictions, of course. Anything less is a leadership failure. Thank you for you and your service to our community. Please keep leading.
Our next comment is from Jeremy Nelson. No face masks. Forcing us to wear them is a clear violation of our constitutional rights.
With well, no, he's already commented. Next comment, Lori Prim. While I am aware of the very real concerns about throwing God's wonderful breathing system out the door, I hope you'll consider those of us brave enough to risk wearing an extra piece of cloth during a pandemic and require others to do the same. Next.
Comment from R.J. Pazzi.
Nope.
No?
Nope. You only get one bite of the apple.
Oh, okay.
Next comment. Jane Logan. Commissioners, I want to take a moment to respectfully request that you consider enacting an ordinance mandating face masks or face coverings be worn by anyone with limited exceptions who is obtaining a good or service or visiting a business establishment in Martin County. The World Health Organization, the Center for Disease Control, the Florida Department of Health, scientists, and medical professionals all recommend that people wear face coverings when in public. Unfortunately, many are not taking this recommendation seriously, and Florida and Martin County continue to experience increases in COVID-19 cases and deaths. When enacting the recent business ordinance requiring employees to wear face coverings, this body also strongly encouraged the general public to wear face masks. I'm sure you have seen firsthand how ineffective this recommendation has been. I, as a customer, cannot enter a governmental agency in Martin County today without a mask or face covering. Clearly, then, this county understands the science. That said, all I ask is that the board take action to provide your constituents the same level of protection you are already affording themselves and other governmental employees.
From Arthur Hammond, I am in favor of all restaurant personnel to wear masks and gloves. Also, anyone who has had direct face-to-face meetings with customers in the county, cashiers, salesmen, etc. George?
Next comment, Shannon April. Has anyone actually read the outside of the box that the masks come in? Warning, this mask is an ear loop mask. This product is not a respirator and will not provide any protection against COVID-19 or other viruses or contaminants. They are also causing harm to the lining of your lungs in long-term use. It has to stop or you will have so many lawsuits on your hands. In simple terms, they don't work like Dr. Fauci said. So please stop spreading fear and instead share facts.
From Stephanie Berard. Dear County Commissioners, this may be a silly comment, but I had to share my experience with you. I arrived at Jensen Public Beach to go for a run and sat in my car while on a phone call. What I observed at the showers was, as a healthcare worker, disturbing. I witnessed 3 different groups of people use the showers, one after another, rubbing their eyes, nose, face. I need to skip the next piece. While alternating, pressing the on button. I can't even imagine what the transmission rate would be should someone with a highly contagious disease such as COVID-19 use the showers in this manner. I know people are insistent upon keeping the beaches open, but something needs to be done about the area the public has access to in an attempt to lower the transmission rate. Thank you for your time.
Next comment, Dr. Jason McManus. I am a cardiologist who practices in Martin County. I round each day in the hospital environment, but also work in the outpatient clinic. I have witnessed firsthand the dangerous and unusual effects of COVID-19. I have also seen a seemingly random distribution of this disease. Many of the patients are unaware of where or how they contracted it. We are proud of our excellent healthcare system in Martin County. The medical community is resilient, but our system could be quickly overwhelmed if the number of infected citizens continues to grow. The increasing census of COVID-19 positive patients at Cleveland Clinic Martin Health has become alarming over the last 2 weeks. The statistics show an increasing number of younger patients who may not follow public health suggestions. While not perfect, wearing masks and prudent minimization of exposure continues to be our best offense and defense. A mandatory policy similar to what Palm Beach County has passed could save lives and minimize the number of ill in our community. I hope that you can help protect our community and our healthcare system by implementing such policy. Thank you for all that you do for our community, and thank you for your assistance in this challenging time.
The next comment is from Karen Resiniti. Good morning. I am president of Martin County Education Association. This is my first time watching a county commission meeting. There is no need to read in open to the public. As a suggestion, open to public is usually timed maybe for an hour and 3 minutes to speak. When we have school board meetings, all emails for public comment must be received by 12 p.m. day of meetings, which start at 4 p.m. I suggest you put a time deadline on public comment emails. As Mr. Campy stated, not putting a deadline only allows for the meeting to be hijacked and it becomes a public debate with people reacting by email to previously read emails. Respectfully.
Next comment, Brian Moriarty. I keep hearing that everyone in the medical community is for masks. I have a signed petition from 14 doctors in our local area, including myself, who are against mandatory masks. We think that their effectiveness is unproven and believe that it should be a person's right to choose if he/she wants to wear one. Please, no mandatory mask orders. Thank you.
From Ann Dillon. Good morning, Board of Commissioners. First of all, thank you for your time. I know Martin County has a lot on their plate right now, and I know that making decisions regarding mask wearing has been a controversial subject. I also know that no matter what you all decide, many will not be happy. But I also know that you must make a decision that has our community's best interests in mind and at heart. I know that some feel strongly about supporting businesses that require masks, and some that feel strongly opposed to it. The bottom line is safety. It's not about who is going to be upset. Quite frankly, I don't care who likes it and who doesn't. The fact that the virus continues to spread after months and has spread much faster since reopening would indicate to me that we need to take a step back and work together to bring our cases down to a minimum. By mandating that only retail and restaurant workers be held accountable is nonsense. As you have heard from medical professionals throughout our own community that are on the front lines working at local hospitals and have heard also from experts from around the globe, they are begging and urging folks to wear masks, social distance, limit contacts, and take precautions seriously. It seems to me it has fallen on deaf ears in Martin County. We need to mandate that anyone in public places and anywhere that social distancing can't be practiced, that masks be worn, or you will have defeated the whole purpose. More steps with law enforcement needs to take place for those businesses that refuse to follow the mandates and guidelines. Where are they? I didn't hear from one of them at the last meeting. This isn't about hurting someone's feelings or about, this is about keeping Martin County healthy and safe. It has nothing to do with politics or who spends the most money or who donates to the local police department and other agencies. This is about doing what is right for everyone. Nobody, including me, likes to wear a mask. I also don't enjoy teaching at home either. I am not a teacher, but if the numbers keep rising, there is no way I will send my child to school in the fall. If we all want things to get back to normal, then we all must work together as a community and not against each other. We may not like it and it may not seem fair, but we don't like many things in life and life isn't always fair. I urge you to require masks in public places for all and not just workers in retail and restaurants. Thanks.
Next comment, Barry Church. No mandatory masks. Please stop listening to the president of a hospital and all his doctors that do what he says. There are plenty of free thinkers in this community who aren't biased and do not want masks.
From Bambi Yost. Make face masks and social distancing mandatory with fines for those businesses and individuals who do not comply. My 80-year-old mom now has COVID-19. My dad, who was hospitalized for pneumonia and heart issues, can now not come home. I most likely have it as well, even though I just tested negative since I have symptoms. I think I must have gotten it in a grocery or drugstore from someone not taking this virus seriously. We have been wearing masks, washing hands, using sanitizer, etc. I will not let my parents go anywhere other than to doctor appointments and have been doing everything in my power to stay safe. None of us have taken chances, and yet here we are. Please stop allowing ignorant people to continue spreading this disease. I have driven by too many restaurants overflowing with patrons not wearing masks. It is absolutely criminal knowing how many of our elderly and compromised family members and neighbors may die. And what are you all thinking by allowing golfers to share carts again? Please do the right thing. Require masks and social/physical distancing in all places of business. Note, my mom and I are in quarantine. Please call me if you would like to discuss this. I reside in Iowa full-time, but have been in Florida caring for my parents since January. I am appalled by this county's lack of concern. I truly hope that they vote. There is of you who voted against requiring masks and social distancing out. I know that I personally plan to push my parents to vote accordingly.
Next comment, Anthony Sabatini. If you pass mandatory masks for all, I will sue your county just like I sued Orange County and others. I think it's a bad precedent and it's a dangerous step in government controlling your bodily autonomy.
From John Page. Good morning, Commissioners. I am told there will be a vote on whether the Commission should require the wearing of masks when indoors or in public. Of course, you should mandate mask wearing. Your job is to protect your constituents. Indisputably, cases and hospitalizations are rising, and masks show some effectiveness in preventing the spread of the COVID-19 virus. When I go at a red light, I look both ways before proceeding. To ensure I don't endanger others, not myself, I look. I am a man of faith, but I don't leave common sense safety up to God. A related issue concerns reporting of COVID-19 information. A couple of months I emphasized to the Commission the needs for facts. I see that need remains. County website shows number of cases in Stewart, Indiantown, Hope Sound, Palm City, Jensen Beach, other and non-resident. Where is the number for unincorporated Martin County? County website shows 149 hospitalizations. How many are in intensive care? County website shows total staff hospital bed availability 55%. 55% of what? 55% of 100 beds is a lot different than 55% of 300, 600, or 900 beds. Martin County has 1,611 positive cases. How do we compare per person to other counties? I'm told our county is number 1. Please, mandate mask wearing indoors in public places and improve reporting of relevant facts.
Next comment, Ben Strickland. No mandatory masks, I can't breathe.
From Connie, I believe it's Rubel. Please consider masks for all. There is no one in the health industry who has spoken against masks. Follow the recommendation of the healthcare people or go with no masks instead of a halfway approach.
Next comment, Dr. Jean Vickers. I first want to thank you for taking the first step of requiring masking by employees in business. However, as I am sure you know in your hearts and minds, it is not enough. It was an important step, but it was a half measure. The newest state public health advisory recommends masking by all. Municipalities across the state have mandated masking. Please join them and protect all of Martin County residents. My medical recommendation to all my patients is to wear a mask in public, practice strict hand washing, and observe social distancing practice. The science in this is very clear, and it is not just a matter of opinion, in spite of what social media may have you believe. Help us care for the most vulnerable in our community by mandating public masking.
From Carol Goss, thank you for staying focused on the message from the medical professionals in our community. Mask wearing slows the spread. Please mandate mask wearing inside public spaces and businesses. Businesses inside Martin County will be able to stay open if their workers are protected from the general public entering their establishments without masks. Stores and businesses should have the legal option of putting out a sign that requires mask wearing before entrance. Thank you.
Next comment, Dr. Daniela Sadia. We are in a public health emergency. Masks prevent the spread of COVID and save lives. Please mandate masks in all public indoor places and outdoors if unable to socially distance for all individuals in Martin County. This is not a political issue. It's a simple act that can save thousands of lives. Listen to the scientists and the medical community. Mike.
From Samantha Kerr. Please make face covering mandatory in public places. This will reduce the spread, and the science is clear on this. Even in restaurants like the one I work in, customers can enter with face coverings and wear them while interacting with employees or other guests, or if walking around, i.e. going to the restroom. They can be removed once food arrives so they can eat. If keeping people safe is a top priority of yours, please consider making face coverings mandatory so Martin County does not become the next epicenter. Thank you.
Next comment, Dr. Howard Manis. I am a physician in the community watching helplessly as COVID-19 spreads throughout the community. At Martin County CC South last week, I was unable to obtain an N95 mask as PPE as I was told they were being rationed for the COVID floor. The ICUs are being overrun while the county commissioners sit idly violating their fiduciary duty to protect the health and safety of our county. Stand up and do the right thing by making mask wearing mandatory before legal actions are taken against all of you personally and our community suffers a calamity of epic proportions.
From Jane and Bob Hinton. Due to the highly contagious nature of COVID-19, we want Martin County to make it mandatory for everyone to wear a mask in all public places. Present measures have not proven adequate to reduce cases in the county. Thank you.
Next comment, Ellen Aslin. Last week, the Martin County Board of County Commissioners voted to make face masks mandatory for all employees of Martin County and local businesses, including restaurants. Where do you report restaurants that are not in compliance? I feel the public should be required for mandatory masks to be worn in all essential service places like grocery stores and pharmacies. That will protect us to continue shopping with safety. Our seniors are fearful of shopping when so many are not wearing face masks. Thank you.
From Marshall Hollander, as just passed in Palm Beach County, please require the wearing of masks inside all buildings by everyone. This is essential in order to protect all of us from the obvious resurgence that is taking place. Your recent requirement for employees, food workers, etc., while a first step and well-meaning, does not truly deal with the issue, and I think the commissioners know that. Only masks inside and distancing outside will. Only discipline and mask wearing will prevent another shutdown, something none of us want. Those who are vocal in opposing masks, remember this. I would also add that appropriate signage outside of stores and businesses should be required in order to remind people and make them feel that we are all helping each other by doing this. I understand that some stores already are offering one-time use masks if you do not have your own. Thank you.
Next comment, Shwana Smith. Please, no mandatory masks. It's bad enough you forced me to wear this nonsense at work. I'm a single mom and a server, and the AC was broken at the restaurant, and I have had to truck all over the place in a mask and nearly passed out. Please, no more masks.
From Nancy Trudell. As you know, Palm Beach County Commissioners agreed Tuesday to require all residents and visitors to wear facial coverings while in buildings where the public is welcome. Anyone violating the order will be met first with education and then with civil penalties up to $500. Unannounced visits are part of the plan to make sure restaurants and businesses are compliant. Last week's vote was a step in the right direction, but definitely not enough. Please follow the lead of what Palm Beach County has accomplished and vote unanimously at today's meeting to protect Martin County residents and make face masks mandatory for everyone in indoor buildings or when social distancing is not possible outdoors. In addition to this unanimous vote, please discuss and vote on how you will ensure compliance and what steps you will take if anyone violates this order. Please continue to take advice from and listen to your health professionals. It is proven that mask wearing is a key component in helping people to mitigate the spread of COVID-19. We are never going to get this under control if you allow people to be indoors without masks. It is mandatory in many countries now, and other states to the north have been very successful by implementing a mask requirement. We are definitely heading in the wrong direction in Martin County, so we cannot delay this any longer. Now is the time to act on this, and today's meeting is the time to vote before things get even worse. It is so dangerous and disrespectful to restaurant employees and other businesses and their employees for customers to come in not wearing masks when the workers themselves are wearing them. It also makes customers less likely to enter some restaurants, stores, and businesses if masks are not required for everyone, and I would think you want to do everything possible to help businesses succeed. And finally, and most importantly, wearing masks in public helps save lives. The lame excuse of violating an individual's rights by requiring masks is growing old. What about the right to live and to be safe? At previous meetings, you were concerned about suicide, depression, child abuse, and the elderly having to stay home. Too many Martin County residents in these vulnerable risk categories are still staying inside and do not have any contact with anyone due to the lax requirements in Martin County. It has been a long time for them to be alone and inside, and it is going to be even longer if we don't implement this policy today. Enough is enough. I'm tired of people saying if we don't like the fact that they are not wearing masks, then we should stay home. It should not work that way. Too many people are not taking this seriously, and therein lies the problem. We are rewarding their negligent behavior. If people don't want to wear masks, then they are the ones who should not be allowed in public places. No shirt, no shoes, no mask, no service. This vote has already been put off longer than it should have. We are relying on you to protect us and act responsibly on our behalf. Please mandate a mask requirement today before it's too late. Thank you.
Next comment, Mary Molina. Hello. Please make wearing face mask mandatory for everyone when out in public. Doesn't make sense to have just employees wear the mask. We all have to protect each other. The cases here are rising, and it's important for Martin County to get a grip on this. Many states have mandatory face masks, which have proven to lower cases.
From Jacqueline Collins, mandatory mask wearing is unconstitutional and begging for lawsuits.
Next comment, Dr. Mary Chrysiadis. You must listen to the experts. A public health advisory has been issued by the Florida Department of Health. FDOH advises all residents to wear masks in public and socially distance. In addition, the Florida Medical Association President Ronald L. Giffler, MD, JD, MBA, issued a statement urging Floridians to use face coverings to prevent the further spread of COVID-19, and called on local officials to adopt regulations requiring the use of masks in public places. In response to a dramatic increase in COVID-19 cases, the Florida Medical Association, the state's largest physician organization, encourages local officials to adopt regulations requiring individuals to wear face coverings in public places. The statement did not say strongly advise individuals to wear face coverings. The FMA applauds local leaders who put health and safety of their citizens first and foremost. Wearing a mask saves lives and prevents the spread. Wearing a mask may save your life and the lives of others. Don't let family members of mine die. Make wearing face coverings mandatory.
From Perry Grandone, or Grandoni. Many, including myself, are completely against any mandated wearing of masks. There are plenty of health and safety reasons not to wear masks, especially in this heat and for extended periods. All we have are poor statistics and ever-changing claims of the effectiveness of mask wearing, but the bottom line is that the mandate would be an infringement on personal liberty. It would give power to leftist socialists who are licking their chops at the prospect of volunteering to police and enforce the mandate by reporting noncompliance and perhaps taking enforcement into their own hands. And then what? You will increase the already tense atmosphere created by the left-wing propagandists, aka the mainstream media, Black Lives Matter, Antifa, and other fringe groups who want nothing more than to curtail the liberties and that are the natural rights of citizens, in a major step toward implementing a totalitarian government. You will not get compliance from a great many citizens of Martin County who will defend their liberty with stoic determination, and then what? Today, masks, what next?
Next comment, Kelly L. Ricardo. Commissioners, I appreciate your leadership in increasing protections for Martin County residents by requiring employees to wear masks. But, as any leader knows, leading is never over. Don't rest on your laurels. Now is the time to continue moving forward and working to slow the spread of COVID-19 in the communities you serve. As you consider whether to mandate masks for all outside their homes in Martin County, please remember your first responsibility as commissioners, the safety of Martin County residents. To mask or not to mask is not a political question, as some have tried to frame it. It is a public health decision. When you stay aligned with your first mission, the safety of Martin County residents, your course and choice are clear. Mandate masks. Anything less than a mandate for masks is abdicating your responsibility to lead and to provide the best protection for Martin County residents. Every scientific study published shows that masks slow the spread of the virus. Be on the right side of history on this public health question. Mandate masks for all.
From Crystal Michelle, I'm opposed to mandatory masks. When wearing masks, even for short time periods, they trigger migraines in both my 6-year-old and myself. Please do not mandate masks.
Next comment, Dr. Robin Cass. Better to wear a mask than a ventilator. Wearing masks work if we all wear them. Wearing is caring. Make masks mandatory, or we will have more infections and then more deaths.
From Maria Christina. I am a 73-year-old woman with diabetes and do not wear a mask. I further do not want for my civil liberties to be infringed by requiring me to do so. While I am not saying that the virus does not exist, I see danger in having the government deciding how we are to handle our health care. Everyone should practice good hygiene, washing hands, and staying home if they are sick, but draw the line at being forced to cover my face out of an irrational fear and conflicting scientific evidence. I am also concerned with the growing mob mentality that is rearing its ugly face after comments made at the last meeting encouraging putting social pressure on our neighbors to wear a mask. I can feel that pressure when I am out and about trying to support our local economy. Please consider this when you are making decisions that will negatively impact the citizens of this great community. Thank you for giving me the opportunity to speak on this very important subject. Please contact me if you have any questions.
Next comment, Alexandra Chase. Good morning, and thank you for hearing my comments. I am writing today as a lifelong Martin County resident to urge you to consider mandatory masks for anyone in public spaces. My hope is that Martin County can be a leader in the effort to keep residents of Florida safe, rather than a punchline and a joke that Florida has become to the rest of the nation and the world. I have been guilty of not taking this crisis seriously in recent weeks. As businesses started to reopen, I felt more comfortable. We started shopping in the stores again rather than having items delivered. We enjoyed the beaches, parks, visited with friends and family, including my father, who is over 70, with conditions that would put him at higher risk. We started to feel safe. Why would the state open if it wasn't safe? It must be safe, we thought. And we felt reveled to get back to some normalcy. We even allowed our son, who has been begging to go to the playground since the start of the lockdown, a chance to play at his favorite park by the river. You have never seen a kid so excited. You would have thought we brought him to Disney World. It must be safe, right? Our local government would not open if it wasn't safe. 2 days later, my husband received confirmation that he was exposed at work. My heart sank. We just had a family dinner, and my parents and may have unknowingly exposed my elderly but spry father to COVID-19. The thought that our complacency could put him at risk of hospitalization and possibly death woke me up to the realities of this virus. Since that day, we have received more and more calls from friends, coworkers, and family that have been exposed to or confirmed positive COVID-19, most of which have occurred in the last 2 weeks. I urge you to please mandate masks. It is a simple step to curb the exposure. I do not want to see businesses and schools close again. We can remain open and endure this small inconvenience to literally save lives, along with the mandate on masks. I would ask that the county consider an educational campaign on how to properly wear a mask, how to care for a mask, and who should be wearing a mask and who should not be wearing a mask. Specifically speaking about children under 2, the CDC does not recommend masks for anyone under the age of 2 or for any person who has trouble breathing or unable to remove the mask without assistance. I want to compliment Cleveland Clinic, Martin County Department of Health, and the county commissioners for your transparency and focus during this crisis. As state and federal leadership continues to fail us in the fight against COVID-19, local leadership...
Time's up.
From Lisa Marie. As you are all aware, there is conflicting information, data, and opinions on the need and use of masks. Many doctors, nurses, and scientists have spoken out about the virus and about the mandated use of masks and their detriment to the health and well-being of healthy people. Unfortunately, you will not hear those testimonies from the media. There is a concerted effort to silence the dissenting opinions and their evidence. It's akin to a modern-day book burning. I will gladly provide you with reliable, open-sourced documentation if requested. I'm writing you today because the order that you placed on all businesses and employees at the last meeting is concerning, to say the least. If you intend to place that order on all citizens, as is being talked about and pushed by some in the community, you will be violating not only the U.S. Constitution, but the Florida Constitution as well, and opening yourselves up to litigation, as I am sure you are aware. But I am I am not an attorney, but from what I understand after consulting with one, requiring everyone to wear a face mask or covering violates several parts of both the U.S. and Florida constitutions. One, it violates the Equal Protection Clause if you allow some people to not have to participate in the mandate. Two, the current order is categorized as a misdemeanor. It violates due process because it's arbitrary and unreasonable. It bears no rational relationship to the original reason for the lockdown, masks, and social distancing order to slow the spread. The goal of these actions was to flatten the curve so hospitals wouldn't be overwhelmed. The curve was flattened. Any further clampdown of personal freedoms, like trying to forcibly mask the healthy, is an attack on our 14th Amendment and our right to liberty. Then there is the big one that messes with our Second Amendment right to keep and bear arms. It is unlawful for any persons to carry a firearm and wear a face covering in the state of Florida. Florida statutes 876.12, wearing mask, hood, or other device on public way. I am a licensed gun owner and carry wherever I go. I can't by law wear a face covering. Masks may also cause medical problems for some wearers, even those who don't have a pre-existing medical condition. Also, there is no scientific evidence that supports healthy people wearing masks. However, there is scientific evidence that shows germs are trapped near the nose and mouth and that cloth masks reduce oxygen intake. All of these things are detrimental to our health. And here's another biggie. Do you know that homemade cotton masks and bandanas that many people are wearing do not stop or even slow down the transfer of coronavirus or any virus for that matter? Here's a link to an article written by a scientist that houses many studies you can investigate, and then there's a long link. I could write a 20-page dissertation about all the things that are wrong with this situation, but I'll spare you and keep this brief. I'll end it by saying the most concerning aspect of the last meeting you all had was this. Mrs. Hetherington told a story of how she was in the Carolinas and everyone was wearing masks even without a mandate. She made comments about how she thinks everyone...
Thank you.
Next comment, Doris Sanders. For the safety of all Martin County residents, I believe it is urgent that the commissioners mandate the wearing of masks for the public. With the continuing spikes in Florida and in Martin County and the lack of action on the state level, it is imperative that everything possible be done to protect your constituents. It is inconceivable that the residents and visitors currently in Martin County are not willing to voluntarily protect themselves and others by wearing masks and socially distancing. But that is the case. Please remedy this problem by declaring a mandate for public wearing of masks. Thank you.
From Sarah West, no mandatory masks, especially for children at school.
Next comment, Ellen Stevenson. On Wednesday, Florida called out Dr. Gupta for closing too late and opening too early. I thank the Commission for requiring masks for certain employees, but it's not enough. A recent international study conducted by the University of Miami stated, if you are wondering why major health organizations like the CDC are recommending face masks, the answer is simple. Research indicates that doing so stops the spread of coronavirus and saves lives. The most recent evidence comes from a worldwide analysis that included 169 countries. Researchers found that the death rates increased by 43% in countries where people are not wearing masks, but just 2.8% in countries where mask wearing is prevalent. Please protect the citizens, first responders, and healthcare workers of Martin County and require masks of all who are in public.
From John Bartz. Is there a number to call to report businesses for not complying? I have encountered 2 restaurants and 1 business in the last 2 days with none of the staff wearing masks. I called the health department. They deferred me to the county commissioners. I left message. A phone number to report businesses would be helpful.
Next comment, Elizabeth Gregory. As a homeowner in beautiful Hobe Sound, I would like to support the mandatory mask wear in Martin County. Massachusetts had one of the highest cases of virus last spring. The governor made mask and social distancing mandatory. The citizens of Massachusetts have joined together and did wear the masks and did keep social distancing. Today, Massachusetts is one of the lowest, if not the lowest in the country. If people work together, much can be accomplished. P.S. There are many sources to check my info. Thank you for your time and your hard work on this important topic.
From Susan Collingsworth, please stop the push for mask mandates. I want to give you an example of why masks do not work. Masks were mandated in Maryland in April. Let's compare the two states. Maryland corona deaths are 3,052. Maryland population is 6 million. Florida deaths are 3,144. Florida has a whopping population of 22 million. On a side note, I am tired of seeing people leave their masks on the ground and in parking lots. These are showing up in our waterways. We live in a county that has banned straws in areas but mandates toxic masks. This is pure lunacy. No one is talking about the litter issue.
Next comment, Rich M. Masks should be recommended but not required. As a licensed concealed carry permit holder from the state of Florida, I am legally not allowed to carry a weapon per Florida State Statute 876.12 and wear a mask. If you are forcing me to wear a mask, you are putting me in a precarious legal situation. Essentially, I either forfeit my rights or become a criminal.
From Jake Roberts. Governor DeSantis has come out several times this week against mandatory masks. Why do you continue to want to go against him? He wants to leave it up to the person to decide. We have rights. Listen to our governor.
Next comment, Kathleen Usage. I am requesting that the commissioners immediately protect the citizens of the county and mandate the use of masks and social distancing for all residents and visitors. The research is clear. The board has access to the internet and information from around the United States and the world regarding the increase in percentage of cases. The board had recommendations from the CEO and president of Martin County Cleveland Clinic, a global healthcare system, as well as your own public health officials. You are elected officials, not infectious disease specialists. You are elected officials charged with protecting those who elected you, not balancing if your ruling will be unpopular, and not support your reelection. Since you already followed faulty advice from the governor and businesses are open, the very least you can do is mandate masks to save lives. Public health is not a political issue. Decide on the side of saving lives, not saving your next election.
From Teresa Smith. Just because someone tests positive does not mean it's a bad thing. They are building immunity naturally while the hospital system is not overwhelmed and the death rate continues to drop. Please do not make any more mask mandates at this time. You haven't even seen the results of the last mandate from last week.
Next comment, Gail White. As Martin County sees an increase in COVID-19 cases, I wholeheartedly support the mandatory wearing of masks in public. This is extremely important to the health and well-being of all of our citizens.
How many more, George, how many more public comments do we have?
4.
Okay.
5, sorry. Next comment, Steve Rogers. According to the COVID dashboard, there were about 40 deaths in all of Florida on June 1st, and about 15 deaths in all of Florida a week ago, and just 5 deaths yesterday. The bar graph shows a steady decline for the entire month. Those few deaths may have been marked as COVID deaths, even though they may have died with COVID, not because of COVID. Everyone needs to calm down and stop with this mask issue. No mask, please. We're gonna be fine.
From Judith Rothenberg. The coronavirus is not under control. It was too early to open up, and now we are facing the consequences. You have the power to mandate masks. Please do it. If we don't change people's behavior now, more people will become ill and the economy will continue to convulse. More jobs will be lost, more people will die. If you do require masks, it will help the economy as well as save lives. I have lived in Martin County for a long time and I have spent a lot of money here. Right now, I am not going to any restaurant or store where employees don't wear masks and where social distancing is not respected. There are many other people who feel the same way. We want things to open up, but we are trying to stay healthy, trying to keep our families healthy. The economy and public health are inextricably linked. This is not a political issue. It is a public health issue. I'm sure I don't need to remind you that your responsibility is to protect the citizens of Martin County, no matter what your party affiliation. Wearing a mask is a relatively tiny inconvenience. It has nothing to do with constitutional rights and everything to do with keeping people working, stores and restaurants open, and saving lives. Please save the economy and save lives. Please require masks in Martin County.
Next comment, Nanette King. Dear Honorable Martin County Commissioners, this is again another plea for at least one COVID-19 72-hour testing site for walk-up or walk-in patients whose doctors are trying to schedule surgeries and procedures which were canceled due to COVID-19 pandemic and are now open again. This site must be for those unable to get to transportation to the drive-through due to the lack of any type of transportation. Marty fixed routes cannot, nor can Marty ADA paratransit buses, nor taxis or Ubers or Lyft rides. Yet there is a resolution to this dilemma. Number one, have a strictly walk-up COVID-19 tent placed in the parking lot at the intersection of Federal Highway and Canner Road. Why? Because all buses have to stop there or very near there, north, south, east, west, and even the Indiantown transfer can meet at this intersection. Manual wheelchairs can finally get a chance to get medical needy surgery and procedures, actual life-saving medically needed attention. Yet they must have the 72-hour COVID-19 72-hour test prior to being scheduled or canceled due to the lack thereof. Now understand, I am one of the unfortunate patients, and this must be addressed immediately, ASAP. I just one loss of life due to patient being denied the treatment, surgery, or procedure requested by their physician can cause you to be held liable due to denying them accessibility to a walk-up COVID-19 72-hour testing site. I have tried to contact George Stokas to read this to you in 3 different avenues. I pray you will attend to this immediately. 2 heads are better than 1. Should you run into a brick wall, consider Sailfish Park as an alternate site, or notify me. Being a major event promoter in Daytona Beach, Florida for 15 years, problem solving was my niche. I'd be glad to help, especially when so many lives are on the line. Sincerely and respectfully, Nanette King Carter.
From Leon Talton. Your concerns in response to this public health crisis is a breath of fresh air. My request is for you to focus on the majority, not the vocal minority. People are free to behave as they choose in their private homes. In public, we need to be courteous and respectful of others, which at this time includes wearing a mask. We have asked workers of all kinds to wear masks to protect patrons, patients, and clients, and now we need to protect them by mandating public mask wearing. When our numbers have improved, this mandate can be revoked. In my experience as a physician, people who have initially balked at recommendations to socially distance and wear a mask promptly forget their stance when they or their loved ones become personally affected by this virus. The virus is non-discriminatory. Unfortunately, many of those affected are also financially unprepared for the consequences of a long, serious illness, even if it is not fatal, which means the brunt of the cost of their care will be borne by our local hospital system and eventually by recommendations and evidence, and eventually by taxpayers. In my opinion, this is simply another reason why we need to heed the recommendations and evidence worldwide that unequivocally demonstrates the public health benefit of mask wearing until we have moved through the worst of this crisis. Respectfully, Leon Talton, DO, owner and sole physician at Whole Life Direct Primary Care.
Next comment, Jackie Transinger. Good morning. My name is Jackie Transinger. I want to thank the physicians who have been speaking at these meetings and giving us their professional advice. And I want to thank Mr. Lord for his important comments and suggestions. Those of us who do not belong to the no mask cult do not think you are an evildoer, Mr. Lord. Anyone who does not agree with mandatory masks just does not understand what the virus is about and how it spreads. Dr. Fauci has explained this, so have all of the other professionals who are now suddenly not allowed to have daily press conferences to keep us informed. Do you want to close everything once again? We are getting to the point in Florida where that may be our only answer to the over 5,000 cases we have had daily this week, and before the 50,000 Republicans with no masks descend upon Jacksonville for their convention. The scary part is that the median age has dropped from over 60s age group to the 30s age group. I wonder if those young folks will be asked to risk their lives for the business community to open too soon, as we older folks were asked to do. We have a small county, not densely populated. We have been lucky that our cases and deaths have been low. But the way things are going, our hospitals might become challenged, and that harms all people. Those with health emergencies, those who need emergency surgery, everyone who lives in Martin County. I lived during World War II, when the government asked us to sacrifice constantly. No one would dare say to the black shades in their windows, to not eating meat, and to the other food rationing. We listened to our leaders and cared about each other and defeated the enemy. But then we had great leaders back then. Please be great leaders now. Masks must be mandatory. And that, Madam Chair, I believe is all the public comment we have at this time.
Great.
Mike,
Okay.
can I have your copies, please?
So that completes our public comment, and we are well past our closed captioning break by 40 minutes. So we are going to take a 10-minute break and come back at 11:20.
Okay, thank you.
Okay, we are back from our closed captioning break. It's 11:25. We've completed our public comment portion, and I'm going to move to commissioner comments. And Commissioner Smith had a prior commitment, so we are down to 3 now. So I will start with Commissioner Camping.
Commissioner Hurd, please. I defer.
I'm sorry.
Good morning. To get to the matter that's before us, I think, is that no matter what metrics we use, Martin County is moving in the wrong way, and we need to do everything that we can in order to decrease these rates, these trends. Our death rates are going up at an alarming rate. Our positive infection rates are perhaps the highest in the state. Our county rates are double that of the state, which is a pretty low bar. Hospitalizations are increasing. I'm making a motion to make masks mandatory for anyone inside buildings where the public is welcome. I think it's absolutely essential that we do everything that we can in order to stop the spread of the pandemic, and this is certainly an important step to take.
Okay, thank you. And we have a motion on the floor.
So far. Madam Chair, thank you very much. For those people that are just joining us now, we've heard this morning over 60 public comments, either email, Zoom, or here in person. I'm sure all of us have been hearing public comments from our citizens for and against for quite some time. I mean, especially even after last week, where we took a logical step of trying to stem the increases that we've seen. I have tried as much as I can through this whole process to do research, to study, to educate myself with people whose opinions I respect, both in the medical field, doctors, medical professionals, our staff, folks from the hospital, folks from the health department. I've followed along carefully with what the governor has done. I've been watching the meetings when they had the briefings and daily briefings in Washington, D.C. I actually watched the entire Palm Beach County Commission meeting, or at least the section that involved their most recent issuing of a mandate for their general public to wear masks in public, inside buildings that the public is welcome. They did have some caveats to that, which makes sense. You know, I understand that people are very passionate about this issue and they are entitled to have personal opinions, but the 5 of us, or currently the 3 of us, we represent everyone. We have no choice but to represent everyone. So I'm not allowed, I don't believe, to have that same level of a personal opinion. There were a lot of comments in Palm Beach County of folks that were very upset that there could be a possibility that their board would vote in favor of the mandate for everyone to wear masks. And I listened carefully to what they were saying. And then there were also quite a bit of public comment for people that were in favor of the masks. And they tended, not exclusively, but they were most likely medical professionals versus a lot of the folks that were not for it. I will tell you honestly that I lean away from requiring government mandates traditionally. But I've been putting pieces, if you will, weights back and forth on a scale. I come into this issue really neutral, understanding what I've heard from medical professionals, but also understanding what I've heard from even friends of mine that are opposed to us giving any kind of specific direction and mandates on mask wearing. However, and I know that people can look at statistics and find a way to view them that sort of makes the numbers agree with what they're thinking. I've been telling people that I feel like we're in a tug of war, and the commissioners are the rope. And, you know, there are too many variables to be ignored, as Commissioner Hurd mentioned, you know, whether people want to agree or disagree with Mr. Lord and others that have come forward. I had heard yesterday that the governor had mentioned specifically Martin County in his remarks during his update. So I went to YouTube and I found it. He was speaking at a Catholic high school, it looked like. And then he had a press conference, and then he did specifically mention that Martin County had one of those areas of concern. The numbers and the statistics that we've been talking about, the ones that I've always considered, have been how many people are in the hospital. Not cumulatively have been to the hospital, but currently how many people are in the hospital. And I am able to get that information. I think most of us could by asking the specific questions, even if we don't put everything on the dashboard, because it would then become cumbersome with information. Our number this morning, the positivity rate, is at 11%, which I think is probably, if not the highest in the state, got to be in the top couple, the highest in the state. And I'm not a doctor. I don't pretend to be one. I don't want to be one. But as a representative of the public that has put me here, I have to listen to that information. I did hear some interesting concerns this morning from residents that talked about they had medical conditions. I know that most of the language, even the language we talked about for employees last week, did craft exemptions into that. I heard yesterday and I heard again this morning the concerns of concealed carry permit folks. You know, it makes logical sense that if you are entitled, legally eligible to carry a concealed weapon, it would be counterintuitive that you would also have a mask on. I did get an opportunity during the break to speak to our attorney, because I'm not an attorney either, but I have the benefit of speaking and getting advice from our wonderful county attorney. And my only concern, Commissioner Hurd, in seconding your motion right now is twofold. One, there's only 3 of us here today, and I understand specifically why our colleagues that aren't here, and we don't have to get into everybody's personal business, but I know enough that those are legitimate reasons why they are not here. And I think people, if they knew specifically why my colleagues are not here, they would agree with those set of circumstances. But also, I don't believe, and Ms. Woods, during the break I asked you, and maybe you want to put it on the record, you're not prepared at this very moment to, you're open for direction, but you're not ready with the language. Last time when we made the vote for employees, we had given you enough time to craft the language, to do the research, to see what other communities have been doing. You're not at that position
No,
this
sir,
moment,
I have
correct?
not received direction to draft a mandatory emergency order. You're correct.
Okay, so that causes me concern. And so, Commissioner Hurd, do you have some timing involved in your motion? Because an immediate motion, we would be jumping out of the starting gate with no real information, and that could lead us to potential problems. I would assume I hope you would agree to that.
I think that we need to act quickly. For some, this is a matter of life and death. So waiting for a week would be reckless and irresponsible behavior for us. We have the ordinance that we approved last week. Put it up there, and let's craft language that will make it mandatory. The language last week was strongly recommend. Well, let's change that language to instead be that it's mandatory, just like it's mandatory in the commercial establishments for employees to wear masks. Don't look for a way out.
Please.
Look for a way in. Look for a way to say yes. Look for a way to better protect our residents.
Yeah.
Look for a way to get that ridiculous infection rate from 11 down to 0
Listen.
Our county attorney has her light on.
One moment, please. I just feel it's important to respond.
Well-
Commissioner Hurd, I'm not looking for a way out. Okay, I have been leading with this as you have from the beginning. I have been very careful to treat you with the utmost respect as a colleague, as a human being. Don't start with I'm looking for a way out. I'm not. You know, I know you're an all-in kind of personality. That's your prerogative. It's a good spot for you to be politically. You're all in. I get that. But don't make the assumption that I'm looking for a way out simply because I'm trying to make sure that this is as appropriate as could possibly be, that it could stand up to legal challenges, which I assume we will see. And you're not an attorney either. I just wanted to hear some direction from our attorney. I'm not looking for a way out or watering something down.
And our attorney has her light on.
Yes, I put my light on because there are a number of approaches that can be done for this. Commissioner Hurd, to your comments, we didn't pass an ordinance, we did an emergency order.
Okay.
There's a difference. Some counties have passed an emergency ordinance. Some counties have gone forward with a emergency order, which is Palm Beach used an emergency order. I believe it's Leon and Monroe, maybe a few others are considering emergency ordinances. So that's a question of approach. There's also been, since your last order, a couple of issues with the Department of Health, as well as back and forth with the governor's office that talks about exemptions. So, you know, we'd like to talk about that. That wasn't an issue a week ago. It's been brought up now. The Department of Health's edict came out the day after we signed our emergency order, so I want to make sure we're threading that needle. You know, and I want to make sure that I use the proper whereas clauses. And again, that, you know, I appreciate board direction if the board, you know, that they look through as what the whereas clauses are and what we're basing this on. I typically don't, as well as I'd like to have a chance to talk to the sheriff, because we've got enforcement. There's various enforcement issues, and so that's another discussion that, you know, I need direction on.
I have some questions on enforcement issues, but Taryn?
Yeah,
go ahead.
if you don't mind. So we've been in contact too with our residents, or our counterparts to the north, Indian River and St. Lucie, and they were looking at our initial order and drafting similar language so that the three counties would be on kind of the same page, if you will. The sheriff has indicated that he will do his very best for enforcement, but he cautions that, you know, as you put forward these enforcement challenges, that's how he sees this. There was a comment made about where you can file a complaint. Please don't call 911, depending on where this goes, even where we are today. There is a form on the DBPR website that you can fill out for restaurants or businesses that are non-compliance.
So that was part of my question. There was a public speaker earlier that said, well, who do I contact? They had contacted the Department of Health and were told to contact, you know, commissioners. Who do they call, and who is responsible for enforcing?
DBPR is responsible for those, for the food service.
It depends. I'll give you an example. This week, someone wrote in and were complaining about a particular.
More clearly.
It depends. You know, if county staff can assist with education, we try. I'll give an example. My office contacted a local post office to remind them. They were not under the impression that they thought that barriers were the same as face masks, and so as soon as we had that conversation, they agreed and they started wearing it. So in a lot of cases in the last couple of days, including Indian River and St. Lucie, they've been crafting language in their emergency orders that talks about the first option is to inform and persuade, and in the very last instance, Palm Beach County has the same language of fining folks. So you know, again, the devil's in the details. It's how exactly you want to lay this all out and how it's enforced.
Right, and there's a non-emergency number for the sheriff's office, which is 220-7170. So we will get that out there as well. So any emergency order that we put out there and there's a violation or individuals feel there's a violation, they can get to that number as well. Or call, you know, they can call our office or they'll send us an
Yes,
email.
I'm happy. I've answered a lot of emails of, you know, well, here, I would suggest, here's a copy of the emergency order. You know, you can approach the owner of the business, say, here's where the order is. And, you know, oftentimes, it's people acting not out of malice, but just lack of understanding what the emergency order says.
So it's DBPR who.
Which is the Department
they
of
would
Business and Professional
call,
Regulation.
They regulate
But it's the,
restaurants, but it's our order.
so it would be our law enforcement that would enforce it?
For the penalty, I believe it would be under our emergency order. I don't know whether DEPR, I'm happy to give a call to see if they would also contact a restaurant or anybody they license to make sure that they're following our emergency order as well. I don't know the answer to that sitting here, but that would be another option. For example, with the post office situation, I looked at the U.S. Postal Service, and you can usually, you know, find out what their requirements are.
Oh, okay. Commissioner Campy?
Yeah, just a couple of points. One, I appreciate Ms. Wood's enthusiasm for assisting, but I think you should be cautious of that because your department will become the go-to place for that. The reason that I think it was appropriate when you mentioned that you assisted with the post office, because the post office does not fall under the auspices of the Department of Business and Professional Regulation,
Correct.
obviously. But this exchange, although very appropriate that we're having here, just illustrates the fact that we cannot, no matter how terrific it looks and feels, to say, I make a motion that we do this right now. There's a lot of moving parts to this. This is a very controversial issue. It's dividing our community. We don't want to participate in crafting something that leaves us as a county vulnerable. That's always been your mandate, to protect us from the possibility of lawsuits. You can't, you know, make it impossible for us to be sued, but we'd want to at least make sure that what we're doing here or in anything else is crafted in such a way that we are protected from that. I know that in Palm Beach County, they wanted it to be more of a civil infraction than a criminal infraction. I agree. I know that they wanted there was concern over, look, we can all understand that there is concern within the community and law enforcement. There's a lot of a stress and strain on those relationships. We don't need to layer in something else that would make it a controversial situation where we're going to put sheriff's deputies or the general public in these weird set of circumstances. I know that I'd also heard that Palm Beach County was going to supply each of their sheriff's deputy vehicles with a supply of masks so that the first encounter could be like, look, we have a mask requirement. If you don't have a mask, I have a sanitary mask for you. That's the kind of details that need to be crafted into if we do this. That's what I'm looking for. I want to be able to, with a straight face, speak to our members of the community that are for this and say, I understand and I agree with what we're up against. Because the other thing that I focus on is if we do nothing, if we keep with what we did last Friday, which I was sort of hopeful we could have seen some data and had the ability to research some of the numbers. Now, we're not epidemiologists or statisticians, but anyone can look at the numbers. Now, I'll give you an example. Last Friday, June 19th, we had 97 positive cases reported that day. On Saturday, it was 39. On Sunday, it was 65. On Monday, it was 57. On Tuesday, the 23rd, it dropped to 29. On Monday was the 23rd, I believe. Thursday the 25th, yesterday was 34, and Wednesday it was 28. So in the last week, we've had 349 cases, but we started with 100 on Friday. Now, I don't know if our mandatory employee order, emergency order that we put in place was magical. It wasn't able to instantaneously. Plus, we put it in place. One of the things we didn't do last Friday is we didn't really give you the timelines on when we'd want it. I happened to go out Friday night to downtown Stewart to try to show some support for local businesses because of the Roosevelt Bridge issue. And I won't get into the names, but the place that my wife and I went to, they took our temperature when we walked through the door. They had a big bottle of hand sanitizer at the hostess desk. Every employee, every single employee was wearing a mask. But when we left and we were walking in Stewart, we saw 2 or 3 places where none of the employees were wearing masks, none. And I get it that, that was less than, less than 12 hours earlier, we had put a pretty detailed requirement in place, and some people, honest, legitimate people, could not get their acts together that fast. We have to give some reasonable timelines on when this would kick in. To say at 11:44 we're going to make a motion and expect people to start abiding by it today, where you didn't even have an opportunity to craft the language, we're leaving ourselves very vulnerable to confusion and controversy in something that we don't want either of those things to happen. So that's all. For the record, I don't disagree with what Commissioner Hurd said. I don't disagree with her motion. It's been weighing very heavy on me, but I knew it was coming. I mean, none of us can be surprised that Commissioner Hurd was going to make a motion at this meeting, which is our coronavirus meeting, to move forward. There's been we're all getting the same emails. I don't disagree with her. I just want it to be handled appropriately so that we don't leave ourselves vulnerable to additional problems. And if staff wants to hear a motion and a second and a vote today, fine. Our next meeting is Thursday, because we're heading into the 4th of July weekend. However, if we feel as a group, a small group here, that it should be Tuesday, to give our staff an opportunity to craft this in such a way that's appropriate, I'd rather add a couple days to our current status, which is all employees should be wearing masks indoors in close contact with customers and clients. And we strongly recommend that if we had to take that to Tuesday and craft something that's appropriate for everyone, I'm not opposed to that either. I'm not sure if the motion maker is or isn't, but we're having a conversation on this. It's not some kind of weird chess game. Not for me.
Taryn.
Yeah, I just got an email here. We just heard that the DBPR has suspended alcohol sales in bars statewide in Florida. So just FYI, we just came across the.
Does it say what the definition of a bar is? Is it a restaurant that sells alcohol, or is it exclusively a bar that does not sell, an establishment that sells alcohol and not food?
Where is the governor? The governor's executive order authorized each state agency to suspend the provisions of any regulatory statute of the strict compliance would prevent, hinder, delay necessary action in coping with this emergency.
It's on page 2, number 1.
I'm sorry?
Page 2.
Go ahead.
Page 2, number 1. It defines bars as all vendors licensed to sell alcoholic beverages for the consumption on the premise who derive more than 50% of gross revenue from such sales of alcoholic beverages shall suspend such sales of alcoholic beverages for the consumption on the premises. Such vendors may continue to sell alcoholic beverages in sealed containers for consumption off premises.
I think it's rolling it back to what it was before, correct?
Yeah.
Yeah, vendors who are also licensed as public food service establishments or restaurants under Chapter 509 Florida statute may continue to operate for on-premise consumption of food and beverages at tables pursuant to the restrictions in the order, so long as these vendors derive 50% or less of gross revenue from the sale of alcoholic beverages for on-premises consumption. and it will take effect as of the day it was filed, which is today, June 26th.
Okay, so to clarify, we just got an email from DBPR that notified suspending of alcohol sales.
It's a executive order from the Florida Department of Business and Professional Regulation, yes, doing just that with those parameters.
So let's clarify that that's not a decision that was just made by the commission. We're discussing it
Correct.
here, but this is a Tallahassee issue. It had nothing to do with us here locally.
Correct.
And currently, the emergency order by the state has capacity of restaurants and bars at 50%?
I believe we're at 50% under Phase 2, yes. But then this would, the governor gave additional authority for state agencies to make stricter orders. That's been something that we've talked about on the local government level as well, that other agencies always have the ability to go stricter.
Okay, Commissioner Hurd.
I will revise my motion to direct staff to prepare an emergency order making masks mandatory.
Any time frame?
ASAP, you know, if we can have an emergency meeting on Tuesday, or as soon as possible, certainly before or by the meeting on Thursday. Our death numbers are really alarming. I don't want to drag our heels. I think it's important that if we can meet on Tuesday, great.
Okay, we have a motion by Commissioner Hurd, and we've been joined back by Commissioner Smith. You have a comment, Commissioner Smith?
Yeah, can you repeat everything you just did for the last 35 minutes? No, kidding. So I apologize, so I missed the essence of what the motion or what the direction is. So what are you all doing?
I can give you, Madam Chair, if you don't mind, I can give Commissioner Smith the brief.
Commissioner Camping. Brief synopsis, please.
Yes.
Brief.
Look, I was here, so I can give you one.
Yeah, but I don't need the 45-minute one. I just need the 5, 3.
Doing you a favor. Commissioner Hurd made a motion that we institute a mandatory mask situation, an executive order. There was some language there, but the bottom line is an executive order mandating masks for all Martin County residents and visitors that were going into public, buildings that were open to the public.
In enclosed
Enclosed
spaces
business,
and in
yeah.
instances, I'm assuming where social
And then
distancing is not.
I'm sorry, whatever you're doing, I can't hear you.
Oh, sorry, I was trying to be close. The mandatory requirement was for everyone in enclosed buildings or enclosed spaces, as well as in instances where social distancing is not achievable.
Okay, so just
And
Open to the
and
public.
indoor buildings where the public is welcome.
Oh, correct.
So then
In other words, we can't mandate businesses wearing masks inside their buildings, but where the public is welcome.
Correct.
Yeah.
Yes.
So
yes.
can I ask for clarity? Just so I know, because I'm sure you talked all about this. So, so when you say socially distancing isn't possible, how are we defining socially distancing, and how does that apply to people in a restaurant? So if tables are 6 feet apart in a restaurant, does that mean they don't have to wear a mask because they're socially distanced?
Again, this is part of the reason why I was asking for some time to do.
Okay, so the motion was to bring this back to...
To bring it back, yes.
that's the new version of the motion.
So one of the questions I would like, if you already, I apologize, but if you already did this, please make sure we define what that means. So, because what's going to happen, I suspect, is that people are going to be in restaurants and they're going to believe that they're socially distanced, and that means they don't have to wear a mask.
That wasn't part, Commissioner Smith, that wasn't part of the initial conversation, the socially distancing inside the restaurant. It was that if you were inside the place that was welcoming the public, that you had a mask on. It did not, Commissioner Hurd's initial wording didn't say anything about being socially distanced inside the facility.
But Sarah said that, that's why I'm asking the question. So,
I said it because some of them, I have reviewed once or twice the Palm Beach County as well as some of the other emergency ordinances, and there is usually language that allows for an exception when you're eating or drinking seated at a table.
They have that.
Yes. So there's ways to craft this. It provides some exceptions for example, since our order was signed, the Department of Health has come up with a long list of exceptions that they recommend, which includes people that have issues with breathing and children of a certain age and those type of things. So that's another reason I'd like to set that out. Another thing, and I'm really free-forming here, was to make it abundantly clear. I know, I'm trying to remember, I think both Indian River and St. Lucie have written paragraphs in to make it clear that they are not trying to control school districts or the university system or the state college system or those sorts of organizations. And, if you're going to go to a mandatory mask, that's probably helpful to put something like that.
I had that in my comments, that the direction on if children in schools should be wearing masks should be determined by the school district
Yes.
and their board. I don't want to get involved in dictating.
And I'd like to craft that language because this is a significant change, and so if we're going to do that, we want to make sure who we're trying to direct this at and who we are not. And so I certainly would take your comments as board direction and bring it back to you.
And I think we still have confusion with the public from our emergency order we passed last week. You just mentioned that you were talking to the Postal Service and businesses were calling, public comment said they weren't sure who to call. Enforcement, it seems to be questionable and by whom. So whatever we do, it has to be abundantly clear to the public. And I think that we still have some education to do now as far as our first order. And we have things constantly evolving. The Department of Health exemptions, that's the first I've heard of them just now. And then, of course, the new DBPR email directive that just came in, suspending alcohol sales. I'm going to take a comment, and then we have a motion on the floor by Commissioner Hurd, Commissioner Smith.
yeah, I just want to make sure that we're asking all the things we can ask as a group together so that when it comes back that we didn't leave something out or we didn't miss something. So I think the whole restaurant conversation has to be, I think, Madam Chair, to your point, it has to be really clear because people aren't clear today what exists. I think businesses, I understand the concept of the retail side of this and the restaurant side of it, whatever. But businesses, we need to be very clear how businesses treat it as a whole, because I get asked a couple times a day easily, are my employees required to do so? Another question I think I shared with Sarah last week. There are some restaurants that believe that shields are a replacement for masks, and Sarah shared with me that they were not. So again, all those little nuanced things where we're going to make something mandatory, just the more clear.
You should be careful. When you say Sarah, you mean Mrs. Woods, not Commissioner Hurd.
I'm sorry, I was looking at Attorney Woods, I will call her from now on. I won't use the Sarah.
Just so that people aren't at home thinking
And
that you guys are talking to each other.
Attorney Woods has her light on.
What I was thinking is that what I've noticed that some folks have done, some other counties, is perhaps come up with a draft for you all to consider, and then, excuse me, also have accompanying frequently asked questions or a document, particularly when if the board determines to go towards mandatory, so that we have a handout. Palm Beach has developed something to hand out to folks so they don't have to actually read the legalese and to say, what does this mean, and have some kind of a directive if, that's always helpful in anything that we do, to make sure they understand what the rule is.
Just from my standpoint, I don't see that I can support something that unless it has an education component, it is abundantly clear, and that it's realistically enforceable. Because if it's not enforceable, if we don't do any education to the public, if the public is confused, then it gives a false sense of security to people who think there's a mask mandate and they're safe. And I don't believe that's the case unless it is something that can achieve compliance. Let's face it, the end goal is to reduce transmission. There are other things in addition to masks that we also have to continue to consider. I love that the Department of Health came this morning and they had the 3 C's: avoid closed spaces, crowded places, and close contact settings. I mean, we can't lose sight of, in addition to protective face coverings, we still have to include all of these things to reduce transmission. If the end goal is reduce transmission, we must do these things. We can't just rely on one element, and we must be able to educate the public. I thought the presentation by the Department of Health, where they were going to HOAs and businesses, was fantastic. They were going right to the source and educating them on, the importance of wearing a mask, the importance of social distancing, and as much as we could do that, and I would say in any way that we, the county, can assist in that effort. I think Commissioner Campy made it very clear that the Department of Health is a state agency and separate from Martin County. However, any way that we could assist with that education goals of those 3 C's, I think, is beneficial. But I won't support something that is absolutely not enforceable. Okay, so I don't see any other comments. I do.
Yeah, I do, just a couple.
Okay, we're gonna wrap up with Commissioner Campy's comments.
Thank you. Well, we don't even have a second yet, and before I feel comfortable participating, I just want to make sure it's not so much that I have the ability to ask these questions of our staff in private. I want the public, look, let's face it, this morning was another example that our community is fractured on this issue. And we have several other issues that we're dealing with. We're dealing with race relations in our community and our country. We have the Roosevelt Bridge. The main artery of our community is cut off. We've had unbelievable rain and flooding. So I know we take sometimes, a light approach to some of the conversation that we're having here. But for people that are tuned in, I'm trying to, create a situation where Commissioner Smith said it several times, that what people hear at this meeting, they take as gospel. So I want to be very clear, and if it means being wordy to clarify, I think that if we are right in our emotions and what we do, our actions, I believe we participate in protecting the health and livelihoods of our residents. And if we're wrong, I personally feel at the very least we've inconvenienced our residents. So I will second Commissioner Hurd's motion based on that I think that our ultimate goal is to protect the health. Now, there are people that will disagree with what we're doing, and I'll have to take that as one of the consequences of my actions. All of us will. But my real concern, the thing that has literally been keeping me up at night, is that when the governor closed all of the businesses in the beginning, our situation, our circumstances were really mild then, and everything was closed. So I can tell, I watched his meeting yesterday, as I had mentioned. You can see it on his face, the weight of the entire state, and making proper decisions where life and death is at stake is really weighing on him. So people say to me they don't envy our positions here locally. I don't envy his. But if he gets to the point where he has no choice, where all of the statistics and the numbers have tipped in such a drastic degree that he starts going back to closing businesses and restaurants, that to me is catastrophic. So if we can go to a mask strategy that will allow our businesses to stay open and our employees to keep working. You heard the United Way and House of Hope today say a lot of those federal aid programs are getting ready to sunset, but people's real urgent financial distress doesn't go away because the program ended. So if we can keep our businesses opened, that's why I would do something like this, to protect our businesses. Because if we don't change the numbers, the governor or someone else will be forced to put us back into a situation where people will lose everything, including their lives.
I just want to make sure we have clarity on the motion. So the motion that Commissioner Hurd made was to bring back at our next meeting language.
Sure. I mean, my understanding was that the motion was for the county attorney's office for me to draft a emergency order which would require face coverings for all persons in enclosed spaces that are open to the public, as well as other areas where social distancing is not achievable, and I'll be a little more articulate than I am right now. And then to also include that we craft all of the recognized health exceptions that our Department of Health has included in their provisions, and then to also exempt the schools and the university systems. I'm watching for those that are just listening to me. Commissioner Hurd's nodding her head as the motion maker.
Also, if you could find out the details of what the situation is with the concealed carry.
I will do that. I'll reach out.
So you'll bring back that language?
So we're bringing something back to give me an opportunity to draft that. I'd also like to make sure that we have all of our required findings with the statistics which allow us to take, which are motivating you to take this action.
Thank you. If
Okay,
also,
so
one more point, please. If when we meet again, if you could answer the question where many people say that the actions we're taking are illegal or unconstitutional. Many other communities have already done this, so I'm sure that work's been done. I'd like, not because I need to hear it, I want to inform our public on, that, God bless you, that hear that is not something that we are doing.
And I can tell you that now. There have been challenges in other counties within the state of Florida, and they've been dismissed. So I'm not the guy in Orlando that was said. Now, that being said, anyone at any time can file a lawsuit, but as currently, the ones that have gone forward have been dismissed and have not been successful. There's a broad authority under a declaration of emergency for the government to take action that they believe is in the best interest of the health and safety of the people. This is a temporary emergency action, and there's broad authority for taking those sorts of actions. But everyone is examining that. Yes, Commissioner Campbell.
Palm Beach County had sign samples in their order that I saw on their website. Can we also have the same thing?
Of course.
Some sign samples, some basic clear language that businesses can post? I thought that also helps with education.
Well, again, if it doesn't include education and some compliance when it comes, I'm certainly willing to look at something coming back to us, but if it doesn't include those components, I'm not going to support it when it comes back. But we have a motion on the floor by Commissioner Hurd, seconded by Commissioner Campy. All those in favor, say aye. Aye. Opposed? So the motion carries 4-0 with Commissioner Jenkins absent. And that looks like we'll do comments from Taryn.
No, our next meeting is July 2nd, next Thursday, because July 3rd is a holiday.
Okay.
So-
Attorney Woods. Okay, so
Commissioner,
then.
before you
Yeah.
adjourn, does somebody want to guess, just in case you don't receive the Stewart News, there has been a rumor that the Roosevelt Bridge is going to open in some
Thank you,
capacity?
Commissioner, for
Can you
that.
describe
Yes.
that?
We actually put out a notice earlier based on the DOT's website. They have restriped the Roosevelt Bridge, the north span of the Roosevelt Bridge, and their plan is right now to open it to 4 lanes of traffic, but it will be restricted to vehicular traffic only. There will not be the ability for trucks to utilize that, but they are opening that span for our emergency vehicles for response for us in the city of Stewart. So either Saturday or Sunday, I would say we've got on our website where you can go and monitor what they're pushing out. I would anticipate them to do some kind of a press release or conference or something Also, Commissioner Smith, you've been on those calls. You want to add?
Yeah, so the only thing, the latest yesterday was, I think they're still shooting for Sunday. And they, as soon as they do that, they're hopefully midweek to next week, they will have the old A1A, old Roosevelt Bridge. They're building temporary lanes around the structural components underneath of the bridge. So there's a water treatment area on the north side that they're filling, and they're going to build a temporary lane that side, and they're building a temporary lane underneath where the sidewalk section is on the south side of A1A, underneath of the bridge. I talked with Jerry O'Reilly yesterday, Secretary of Transportation for our district, and with the city as well, and also suggested that, because what they're planning to do, and I saw a comment this morning on Facebook that they're going to divert, when that's open, truck traffic off of US 1 onto A1A underneath the bridge. I suggested, just because I travel that all the time and watch trucks try to navigate through Sailfish Circle on Joan Jefferson, the roundabout there, where the Sailfish is, and then they'll probably be going down A1A to Colorado, then back out to US 1. There's some really tight radiuses and stuff, but that's where all the truck traffic will be routed to. So they were going to study that today, and maybe even get an 18-wheeler to actually run the course, if you will, to see if that's doable, not doable. We will see where all that ends up. But that is slated for probably mid to the end of next week for that operation to open up.
Yeah, and to your point, Commissioner Hurd, we get daily phone calls with the FDOT folks, and Mr. Donaldson's on there as well as Commissioner Smith.
So I will tell you, and for anybody who's watching, FDOT has been remarkable. They are on this thing. They have the best bridge experts in the world working on it. They're traffic planners. Everybody is mobilized, trying to make what exists the best it can be. For those of you who go through the Sewell's Point portion of town like I do, they've been working with the city over there and our traffic folks. They've got that pretty well worked out to where traffic's moving better through that intersection. So kudos to FDOT. They have really, and Jerry O'Reilly, District Secretary, has personally taken this on, and he is on the phone calls every afternoon, as is Senator Harrell and Representative Oberdorf, and it's really good stuff. So that's it.
Great. Good. Thank you for that update. Okay, we've reached the end of our meeting. Our upcoming meetings are July 2nd and the 10th for our special COVID meetings, and our upcoming regular board meetings are July 14th and 28th, with our budget workshops being the 20th and the 21st. And with that, we are adjourned.